the line. I'd like to declare open this hearing of the Senate Community Affairs Legislation Committee's inquiry into the Aged Care Amendment Implementing Care Reform Bill 2022. I'd like to begin by acknowledging the traditional custodians of the land on which we are all meeting today and the individual places that we are on, and pay respects to elders past, present and emerging. And I extend that respect to Aboriginal and Torres Strait Islander people who may be participating today. The committee will be conducting today's hearing via video conference, teleconference and in person. My name is Marielle Smith, I'm the chair of the committee, and I have with me today Senators Rice, Pratt, Nampijinpa Price and Ruston. These are public proceedings being audio streamed live via the Parliament's website, and a Hansard transcript is being made. I remind all witnesses that in giving evidence to the committee, they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to a committee, and such action may be treated by the Senate as a contempt. It is also a contempt to give false or misleading evidence. Witnesses also have a right to request to be heard in camera. If a witness objects to answering a question, they should state the ground upon which the objection is made, and the committee will determine whether it will insist on an answer, having regard to the ground which is claimed. If the committee determines to insist on an answer, a witness may request that the answer be given in camera. On the basis of the limited time the committee has available today, and in the interest of giving everyone an opportunity to speak with the committee, could I ask that all opening statements be tabled so that we can move directly to questions? I remind committee members and witnesses who are appearing via video conference and who are not speaking to mute their microphones. I'd now like to welcome representatives from the Aged and Community Care Providers Association and the Australian Community Industry Alliance appearing via video conference. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been given to you. For the Hansard record, could you please state your full names and the capacity in which you appear today?
It's Paul Sadler. I'm the interim CEO of the Aged and Community Care Providers Association.
Hi, I'm Dr. Nicole Brooke. I'm the CEO of Australian Community Industry Alliance, and here in that respect.
Great. Are you happy to table any opening statements you may have? Okay.
Yep.
Thank you. I'm going to move to questions now. Senator Ruston.
Thank you very much, and hi to Paul and Nicole. I'm just interested in, particularly Paul, in your submission, you go into quite some detail around the lack of information around subordinate legislation or regulations that underpin probably most particularly Schedule 1 and Schedule 3. I just wondered, in the first instance, what sort of consultation have you had with the department in relation to what's likely to be contained in the delegated legislation around exemptions for 24/7 nurses and and the what items are going to be identified for requirement for transparency under Schedule 3?
So thank you, Senator. The first thing to say is that Minister Wells did write to and seek our input on actually all 5 of the major policy commitments that the ALP had made in the election campaign. And that included 2 of the major ones that are in this bill, the home care fees issue and the 24/7 registered nurse coverage. We also provided some commentary on the transparency elements, which are partly captured through this bill and partly were passed in the Royal Commission Response Act that went through Parliament a couple of weeks back. In terms of follow-up from there, we've had a couple of meetings with the Department of Health. We got an overview briefing of the key elements of the 2 bills before they went into Parliament, and had some opportunity to engage with the department around that. And just in the last few days, we've had a meeting with the home care section of the department to talk through the detail that they're proposing around the home care pricing fee caps.
Okay, so on the basis of your, just take the 24/7 nurses and Schedule 1 particularly. In the discussions that you've had with the department to date, do you have any greater clarity around what is likely to be contained within those exemptions than you did when you provided the submission in the first place?
Not on the submission on that front. We've got a bit more detail on the home care pricing one following the meeting with the department a couple of days ago, because that was subsequent to us submitting the submission on the bill to the Community Affairs Committee. But no, it pretty much as we've outlined in the submission is what we know at the moment regarding the exemption provisions for 24/7.
So on that basis, am I right to assume that your recommendation still would be that you would like to see what's contained in the subordinate legislation before we proceed?
Yes, that is correct. We believe that this is a really important power that we're granting to the government. It is consistent with the ALP's pre-election commitments, but what we would say is that until we know the detail of how exemptions are going to operate, we do run a risk that you could end up with unintended consequences, even up to the closure of aged care services across regional Australia if they cannot obtain the staff that are going to be required.
Yeah. There was a comment, I think, made publicly around the fact that 80% of current aged care facilities already have 24/7 nurses on site. Do you, is that a figure that resonates with you, obviously with the oversight that you have of the sector? And if so, is there any distortion in that 80%? Are all those 80% large operators that operate in metropolitan areas? I mean, is there a rural and regional distortion? Is there a small operator distortion? So I suppose two questions. Do you think it is correct that 80% of facilities have got a nurse on site 24/7? And if so, do you think there's a distortion in the breakdown of where they are?
So I need to put a caveat on my answer to the first question. The data that we have is similar to that which the Department of Health and Aged Care has, which is that roughly 80% of homes on a normal standard operating model would have 24/7 registered nurses. The caveat I need to put on it is the impact of the pandemic. So although those were figures that, probably 18 months, 2 years old now, we know that the staff shortage issues have been pretty extreme even in metropolitan areas, and there may well be services that for short periods of time don't actually have 24/7 coverage at the moment. The majority of the 20%, to answer your second question, that don't have full-time registered nurse coverage are smaller homes, some of them in metropolitan areas, but the majority in rural and regional Australia.
And do you have a concern that without the proper provisions that challenge in rural, regional and remote will be exacerbated by any enforced requirement for additional staffing elsewhere?
I think what will happen is that we will see aged care services in rural and regional Australia struggle to obtain the staff. We are already in competition for registered nurses with state health authorities and private medical practices that use nurses in regional locations. It will be important for the wage case that is currently before the Fair Work Commission to be resolved and for that to be fully funded by government in order to increase our potential to be able to recruit the staff required. You will have seen from our submission that what we are asking for is a really conscious policy effort by government to support aged care providers across regional and rural Australia to obtain these staff. If this is done through a series of punitive mechanisms, that will end up in a really bad position for aged care residents in our view.
And in terms of the workforce requirements across the entire sector, do you have you done any modelling or research within your organisation to get an understanding of what additional nurses will be required to meet both the 24/7 commitment and also the AN-ACC requirement of care minutes?
We believe the 24/7 commitment will require around 1,440 additional registered nurses. Now, that assumes that many of those people will be part-time. So on a full-time equivalent basis, it's probably around 860 FTE positions. The additional care minute requirements will require additional registered nurses, but also additional care staff. And we believe you'll be looking somewhere between 14 to 20,000 additional staff overall to meet the 24/7 requirements plus the care minutes requirements.
Okay, so just going back to the 800 versus the 1,440, so your view is because of the nature of the location possibly of aged care facilities and because of the way that some nurses may choose to work, that actually will physically require 1,440 actual nurses, although they won't be full-time. As we know, our nursing care workforce currently don't work full-time anyway.
That's correct. And that's partly because the shifts that are unfilled in most of these smaller homes are the overnight or the weekend shifts. So that's why we don't think it'll be full-time staff. There will be some, but substantially we think it'll be part-time workers that will be required.
And I'm just interested in your views. The Royal Commission coupled the period of time for a nurse to be on site with the care minutes, both general care minutes and RN minutes. The government has sought to decouple the requirement of RNs on site with the care minutes. I'm interested in your view as to whether you think that it has achieved any benefit, or is there anything? I'm sort of keen to understand why you think the Royal Commission would have coupled them in the first place.
Well, I think from the Royal Commission's point of view, they were looking at the overview of what's required to improve quality of care and what is the funding mechanism that will attach to that. We are yet to see the detail of the funding mechanism that the government is proposing for this particular 24/7 provision. So we understand that's going to be included in the October federal budget. It will be important that that links to the requirements in the care minutes and the AN-ACC funding. So we're certainly hoping that the provision is a simple one and doesn't require too much additional paperwork for these smaller homes to have to claim the funding.
Yep. Okay. Just on the Schedule 3, particularly in relation to the areas of transparency, reporting and scrutiny, once again, we don't seem to have much clarity around what is going to be required to be reported. And in your submission, you expressed concerns around that. I mean, once again, would it be fair to say that that you would be keen to see the detail of the requirements of the reportable information prior to proceeding?
Correct.
Great, thank you very much. And I suppose the other question is in terms of the, have you, in your discussions with the department, received any information around the kind of additional costs that are likely to be associated with the additional reporting requirements, and whether the department is intending to provide support or funding for the additional workload that may or may not be required, which I suppose is a bit of a moot point when we don't actually know what's going to be required.
I think your last comment is the correct one. We don't know exactly what the additional provisions are, so we do not know precisely what the government intends to do in terms of additional funding support to allow that information to be collected. We do note that the provision in the Act is one putting the obligation on the department to release information, and much of this they will already hold. Until we see the detail of what's proposed, we don't know how much additional requirement will be placed on aged care providers.
And also interesting that they say may provide as opposed to will provide.
Yep.
Sorry, Mariel?
I just wanted to pass the call to Senator Rice, so if this could be the last question, please.
Oh, okay. I was just going to Nicole, just ask you whether you had similar concerns about the lack of detail and the proposal for much of the detail to be included in subordinate legislation, which we have yet to see any detail of.
Yeah, look, thank you. I support a lot of what Paul said in terms of a real concern around that transparency. Actually, particularly around what that risk management process, which I would imagine that exception process I'd really encourage it to be a risk managed assessment, but it really needs a lot of transparency, both for the public and for the sector, around what those exceptions are and how frequently they're going to be reviewed. I hold concerns. You talk about the coupling between the hours and the care hours and the RN hours. I actually further have a concern that we're coupling those two issues with the Commission and their role and responsibility. So they're very focused and have been, particularly for the last few years, have been focused on those workforce requirements. And if there are exceptions in place, or if there's restrictions of any sort, or the likelihood of that, the Commission, to the extent that the Commission can put non-conformity around that, would be a concern. And their current concerns around the workforce capability and supervision of the needs of the clients, how that will actually impact with the Commission. If you don't mind me just moving to say, our concern is actually not about the 24/7 nursing. We support it and see in our members that 80 to actually kind of closer to the 85% of our facilities being already having that 24/7 coverage. It's actually the very remote ones that we're seeing don't have that coverage, but actually, despite being able to get an exemption and whatever paperwork that involves, they're actually, a lot of them have got really good relationships with the local community that actually has supported the escalation of deteriorating patients or residents in that sector. So we're actually seeing, from an escalation point of view, those smaller facilities actually have some really good relationships already established. Our concern is also regarding, it's not just having the 24/7 nursing, it's really about the level of coverage. So if you look at AHPRA, the regulatory requirements, and the AMNC requirements around a registered nurse, how efficiently, whilst there's a requirement around hours, we would uphold that the registered nurse is actually inefficient. And there's been numbers of coroner's cases, and it was represented in the Royal Commission, that the registered nurse actually can't fulfil their role as a registered nurse when they're operating at different levels of how many clients they're supervising, residents they're supervising, and how many staff they're supervising. So actually, to your point earlier, it's not for us around the hours, it's actually around that point around the quality of service provision. And that is not relevant when you consider one registered nurse for more than 100 residents. And I'm not supporting ratios, but it's a real concern that this requirement is stipulated, the care minutes is stipulated, that actually, whilst the Commission has oversight and their opinion on the number of staff, this is actually not actually solving that quality of care issue. And every registered nurse that goes before the coroner's case around issues, the literal findings have been the registered nurse was unable to fill their obligations because there was insufficient hours. Or the other problem is that if you have one registered nurse for that whole facility, they're actually not, you're not defining the level of experience suitable to the level of acuity in those residents. So you can have one registered nurse that's a new graduate, been out for 2 weeks, and that will still fulfill that requirement. But with the acuity that our members are suggesting with enteral feeding, palliation, dementia, delirium, it just goes on, that level of acuity isn't going to be supported by an inexperienced nurse, even a nurse that's not familiar with the residential aged care facilities environment. Like, we see that being about 6 months wait to develop. Sorry.
Thank you, Dr.
Thank you.
Brooke. We have, I've got questions. Senator Rice has questions. We've got 10 minutes left. So Senator Rice, I'll pass to you. And if I could just ask the witnesses to please keep your answers as succinct as possible.
Great,
Senator Rice.
thanks, Chair. Thanks, Paul and Nicole. I just wanted to ask, in terms of the lack of information at the moment about the exemption to the 24/7 provision, and you've both said that you, yes, don't know what the government is intending there. Have you made submissions to government as to what you think the exemption should look like?
Yes, we have. We've certainly suggested that the exemption should be based on the availability in the local area. So if you take into account the pandemic impact at the moment, we should be able to get a sense of general availability of staff in a region, and that forms a backdrop to whether the steps that the individual service is taking are deemed reasonable or not by the Quality and Safety Commission. We've also suggested that, as the Royal Commission did, there should be time-limited exemptions so that they reflect, maybe a short-term gap in a provision of a registered nurse. The other thing that we're keen to look at, the Royal Commission talked about this, but so have some of our members, is where there might be opportunities to use technology as part of the solution here. So the emphasis in the legislation is around physical presence of a nurse 24/7. But we know that where that is going to be difficult to achieve, particularly in country areas, there may be, through telehealth style equivalents, mechanisms so that nursing presence can be there to link with staff on the ground, even if we can't get a registered nurse there physically all day, every day. So we believe that those sorts of measures need to be looked at.
Thank you. Dr. Brooks?
Look, I agree with Paul's comment. I'd really like to see that transparency there. I'd like to see a flexible model to consider the individual situations happening in those facilities. If you look just in January, our data suggested that 1 in 3 across community care and residential care, 1 in 3 shifts were unfilled. That would really challenge the ability of a facility to fill that. And it's further, depending on the level of documentation required, when a facility does go into outbreak and people are quarantined or furloughed for a period of time, that literally would be unable for them to facilitate those requirements for a very short time, because it all happens very quickly, and the exemption process is not going to be a short process as far as I was concerned.
Okay, so there need to be that emergency measures, to come into play. Can I just confirm your submission said that your understanding was that the legislation as it stands, without having the regulation to clarify it, could enable 1 registered nurse to be on duty across multiple sites? So that's your understanding of the drafting, and have you raised that issue with government?
We've actually sought on quite a few occasions over the last 2 months to chat with the Minister and their team about our concerns. We haven't actually been successful in having those conversations to date, hence the opportunity to raise that in our submission with you. So look, I'm really concerned that the on-site, and being Director of Nursing of many facilities over my time, there is lots of ways to manoeuvre around policies. We see that in the current reporting of how they can exempt themselves through to make sure the data looks better. I see a real opportunity for there's sites with 5 facilities on one site, and you can't say that they've got to be all present in the building because staff have breaks and smoking areas can be out of that facility in many cases. So it really concerns me that those numbers aren't actually capped to what that level should be, because in the end we can't rely on that with care staff doing the level of acuity management that we've got.
Okay. My final question is about funding, and obviously both of these measures, the 24/7 and the increase in care hours, are going to need extra funding to cover those extra nurses. What's your understanding of how that extra funding is going to be rolled out? Have you got any certainty about that from government yet?
We don't have certainty on the 24/7 component, Senator Rice, at this stage. As I said earlier, the detail we're expecting to see in the federal budget. In terms of the care minute requirement, that's linked to the increase attached to the Australian National Aged Care Classification, the AN-ACC. That we've got a little more transparency from government about how that's going to operate. They've set an AN-ACC price at $215.80 per resident per day as an average. And we are anticipating that will see an increase of around 10% in the overall funding that comes to the sector. But we need to recognise that the care minutes requirement will increase from roughly an average of 180 care minutes provided at the moment to 200, and that will be intended to be in place by October 2023. And it is an open question whether that additional funding from the government will fully cover all of the costs of the step up from the current care minute component to the required component. The department assures us that they believe on average it will, and they have put in place a funding mechanism where providers might not be fully covered. The feedback that we and others in the sector, including Stuart Brown Accountants and other firms involved in this, is we don't believe that it will fully cover all of the costs for many aged care providers.
Okay, thank you.
And if
Thanks,
I,
Chair.
if I
Thank you.
if I can just add, if you look at where the care minutes came from, it came from an initial use of the FIM tool, which is a rehab tool. They looked at research across every person that touched as such or communicated with a resident, which included the gardeners, the maintenance, the chaplains, the admin staff, all of those. And then they determined and threshed that through. We're not, and got the AN-ACC tool, we're not seeing any data to actually validate that the current costs are going to be, the current care minutes are adequately covered within the AN-ACC tool, especially for the increasing complexity that's happening. Their deterioration since that's happening in the sector, where we're just seeing people admitting more people with more complexity now as the funding has changed and with COVID, and we haven't got any support from our members to indicate that will cover it. We are thinking it's about 20% at least under what's required.
Thank you, Dr. Brooke. I've got some questions now. Mr. Sadler, do you think there's been enough transparency in the aged care sector when it comes to spending public money?
We believe that additional transparency requirements are essential for the sector as a whole to regain public trust. That was one of the issues that the Royal Commission highlighted. ACCPA, on behalf of the aged care providers, is absolutely up for additional transparency, including greater clarity of what aged care services spend their money on. Our comments in our submission regarding the transparency are about making sure that we focus on the areas that are going to make decisions for older people and their families clearer. We believe that's where the additional transparency needs to focus.
Your submission says that you want to delay Schedule 3, and this is a schedule which goes to increasing transparency around how public funds are spent. why is that the case? I mean, I think the public expect that these transparency measures are put into place with a great degree of urgency. Can you speak to that, please?
So our comments are around understanding what the additional transparency measures actually are, and for the government to engage with the sector very clearly about that. So that's where we are looking at asking for greater clarity about what are the transparency measures that are going to be implemented as part of this bill.
Okay, and one of the things you've said in your submission you're concerned about is what you call limited scrutiny of the information that providers might have to disclose. Can you tell me specifically what you're concerned about disclosing? What are the things which would worry you in terms of us having more transparency in how money is spent? What things would you not want disclosed?
I don't think it's so much about what we don't want disclosed. It's about what's going to be the costs of actually obtaining that additional information. So we need to understand what's expected. We put in the submission the fact that there's new quarterly financial reporting that has been brought in as a response to the Royal Commission. That process is now underway. One of the key issues will be now that the government is receiving that information from us, and the provision in the bill is about enabling the government or requiring the department to publish information. So let's be clear which of those components of financial reporting that are being collected are actually going to be published. So, for example, we've got some comments in the submission about maintenance costs. How will they be published? Administration costs, profitability.
Sorry, that seemed to be two different things though. So you said there was an issue around the cost of preparing the information?
Yeah, it's the cost of preparing.
And then what will be published of the information you're presenting?
Will be published? How will it be made comparable so that families and prospective residents can make choices?
So what kind of information are you concerned about the cost of collecting and providing then?
Well, what we don't know yet is there additional information that the aged care services are going to be required to collect over and above that we've already begun collecting, e.g. through the quarterly financial reports?
An example, if I may add to that. So there's evidence within the home care package review that the paper has now been released that shows it just in the home care sector, there's even the transparency of those reports that are meant to be published, there's actually a very low consistency with the accuracy of and timeliness of that published report, published information versus what they actually found was being done in terms of administrative costs, exit fees, entry fees. So even just from one sector in aged care, we're seeing quite a huge discrepancy in the actual validity of what's being published.
Okay. And so, sorry, Mr. Sadler, can I just take you back to the other part? So the concerns about what you provided to the government and what was being shared. So are there specific things that if the government was to require you to share that you're uncomfortable with sharing, where you don't think there should be transparency on? Or are you comfortable with all information being made available? I'm just trying to get to understand the crux of the concern.
Sure, I understand the question, Senator. It's more about what information is published and how we interpret that for the community to make it understandable. So we've been having lengthy discussions with the department and with the Quality and Safety Commission around how the star ratings that are going to be published from December onwards will operate. Now, that's not in this bill, that was in the previous bill, but it's an example of where the government is collecting information. We're saying we need it to be delivered to the community in a way that it makes sense, and it's not the collection of information per se that then is the problem, other than any additional cost. It's about how we use that information to inform older people and their families.
Okay, but generally speaking, do you support the government's ambition to have a much greater degree of transparency when it comes to the expenditure of funds?
Yes.
Thank you. I'd like to thank both witnesses, Dr. Brooke and Mr. Sadler, for your participation today. It's time for us to move on to the next witnesses, so thank you.
Thank you very much.
Okay, I would now like to welcome via teleconference representatives from the Older Persons Advocacy Network and National Seniors Australia. Thank you for appearing before the committee today. Can I just confirm we have both of you on the line? If you could just state your name and the capacity in which you're appearing.
Samantha Edmonds. Samantha Edmonds from the Older Persons Advocacy Network.
Ian Henschke from National Seniors Australia.
Lovely, and hello again, Ian. I just saw you less than 12 hours ago, so nice to hear your voice again. We're asking our witnesses to please table any opening statements they may have so that we can move straight to questioning. Is that okay with you both?
That is okay.
Okay. Thank you. I'm going to pass to Senator Rice first.
Thanks, Chair, and thank you, and thanks for your submission and for being with us today. I'm interested in OPAN's perspective on exemptions to 24/7 and other things being, and the exemptions set out in the quality of care principles, that they're not in the primary legislation. And so the concerns that the future government could weaken them or remove them entirely. Do you think it would make sense to have the exemptions in primary legislation?
That's a difficult question. Yes, it would be good to have it in the primary legislation, but we also understand that sometimes over time things change and there may need to be easier processes for that to happen. I think our main concern is that there are good protections around those exemptions for older people.
Okay, so are there some things at the moment that you would very much not want to see, that you would much prefer to see in the primary legislation rather than in subsidiary legislation?
I'm sorry, could you repeat that question?
Or just are there any things at the moment are not in the primary legislation that you would much prefer to see in the primary legislation?
Yes, I mean, we would like to, I understand care minutes are not in the primary legislation. We would like to see care minutes in that legislation. And as I said, those protections for older people around exemptions.
Right, okay. You had an example, OPAN, you had an example in your submission about someone on a level 1 home care package that had a massive amount taken out of their package in the admin costs and the management charges. Could you talk through how much of an issue that is?
Look, it's a constant issue that comes up to us through our advocacy work. Fees and charges, as well as statements outlining the fees and charges, come up as the most common issue that is raised with us. We often hear of charges that people can't understand as to why they're being applied, and that example is just sort of one of those many examples that we see. And it seems, it's obviously excessive, and there is, no reasonable means for determining that should be what should be charged. So it's something that we're really concerned about, and that older people are really concerned about. And I guess sort of reflecting back on the previous question, we'd really like to see some further guidance or protections in the legislation around those charges, and that there's really clear guidance around things like brokerage fees, as well as protections for stopping or preventing providers from adding costs onto other charges to recoup anything they're losing from the capping of fees.
Okay, and do you think there needs to be changes then as to how those home care packages are funded, so that, essentially I understand from the providers, they're saying, well, these are real costs for us, the admin charges and the management charges, and that there's no getting away from them because they're real costs. How much do you think that is the case? And it just means that if you're, say for a level 1 package, and if it's being means tested so that you're having to pay more, that the cost is just not viable. So how do you think that there is a way that you could change that? Or do you think that the providers are actually, over egging the admin and the package charges beyond what it really costs them to provide those services?
Well, as I said, I mean, it is the issue that comes up the most in our advocacy work, and there is no consistency of those admin and care charges. So, where one provider might be charging a set amount, another might be charging significantly above that, and it's sort of it's understanding why is there such a significant difference between those charges. Is it simply that it's just being charged that way for whatever reason, whether it's to recoup money, whether it's to gain additional money, or is it something to do with where the provider is based and there are particular issues around that? And in that case, we would need to look at what kind of funding goes in, because there might be barriers that are resulting in providers charging greater admin fees to get that money back. But in general, it's looking at why is there such a disparity? Why are some of those fees so high? So that it, takes away from the care and services older people need. I mean, that's what home care packages are there for, delivering care and services. So what is the reasoning behind such high fees, particularly possibly in some providers where there might be a central point that does all that kind of admin work? So why would there be such an expense attached to each person when it could be averaged out?
Do you have people contacting you who say who don't take up packages because the costs are just they're basically the level of funding that they're getting in actual services being provided is just not worth it for them to do that?
I couldn't say right directly, and I can certainly get back to you on that, but I can say that we do hear from those that do pick it up and then contact us and say they're wondering why they've picked it up because of those additional costs.
Right, okay, thank you. Look, I've just got one question to National Seniors. You say in your submission that it's vital the parameters of any exemption set out in delegated legislation is not open to misuse. The needs and care of the residents must be paramount. Adequate funding for aged care providers under exceptional circumstances should be provided to ensure nursing care is available. So again, what's your view on terms of protecting residents with the exemptions to the 24/7 nursing care not being set out in, or what the exemptions are, and so making sure that the adequate care is available?
Well, I think we've got to recognise that people that go into aged care now are some of the most frail people who need nursing care. And so the point that we're making is you wouldn't accept a hospital without a nurse in it. Why would you accept an aged care home? And I find it curious that over the last few years we've gone away from calling them aged care homes and nursing homes, and now we use this new speak of aged care facility, and we refer to them as consumers. They're very frail old people that need nursing care, and we used to call them nursing homes.
Yeah. So your view is that are you concerned that we haven't got clarity about what the exemptions are going to be, and it's going to be in the subordinate legislation that there are going to be too many exemptions, and there will be people, particularly in regional and remote areas, who won't be getting the level of care through having a registered nurse on call that they deserve.
Well, that's right. I think it is going to be awful for people that live in regional remote areas to not have a nurse available when they need that level of care, and we're going to have to look at that, because otherwise we end up with a two-tiered society, which is roughly what we've got at the moment, where people in regional and remote are more likely to die, they're more likely to get inadequate health care, and I understood that as a society we were going to try and make sure that everybody had access to good quality care. So if you have an exemption and say, well, we won't have a nurse there, and then something goes wrong, do we need a coronial report to say there should have been a nurse there?
Yeah. Thank you. Thanks, Chair.
Yeah.
You can finish the sentence, Mr. Henschke,
Yeah.
and then I'll come to questions. Thank you. No? Okay. Mr. Henschke, my first question is for you. It's the chair here. Noting your comments around the importance of having nurses on site 24/7, there's been a lot of commentary around workforce shortages in the economy at the moment, particularly in sectors like aged care. and some have suggested the government should delay this measure to allow more time to find nurses. I'm just interested in your view on that. Do you think it's important that we stay ambitious and maintain the urgency of this measure?
I think it is important that we maintain the urgency of this measure, and National Seniors Australia is putting forward some proposals which I know would provide more nurses, because we know that there are nurses out there at the moment who came out of retirement, and many of whom were doing some part-time work, who would do more full-time work if they were given a different social security arrangement. And that's a policy that we're calling for, which is let the pensioners work. And we know that there are nurses that do work. One particular nurse comes to mind, a dementia care nurse who's 75. Her name's Heather. She lives in Adelaide. She does dementia care nursing, and she says that when she does more than one day's work, I think it's less than one day's work, she loses 50 cents on the dollar from her pension. Her husband loses part of his pension as well, and she's also raising her daughter's son. Her daughter died when the boy was 9 years of age, and she's been bringing him up for 11 years as well, and he's only just got a job. So we're not talking about people who are statistics. We're talking about a real person there who would do more nursing, and that's a 75-year-old nurse. So we're talking about nurses between the age of 66 and above who are still capable of working, who are being prevented by the system at the moment because you have a penalty system in and a bonus system, and you get a bonus on day one, which is $150, where you can work. Now, a nurse will burn that out in a few hours, and they are not doing it. And I've spoken to nurses who have said, I came back during COVID and then I found that I lost my pension and I was penalised and I had a tax bill. And I mean, so we need to look at how we can ensure that we have a system that rewards nurses that want to go back into that. We should also be looking at nurses that are out there who have to have their qualifications upskilled again. They may have been out of nursing for some time. I know of other nurses in that situation who've had to go back. But we do need to aim high, and we may not reach the target, but we at least need to aim high. Otherwise, we're going to fail our older Australians, and we have known that this situation is going to be coming about for some time. So it's up to, the new government, the new parliament, if you like, to put measures in place that will improve this. And I also know from people who are involved in the importation of nurses into Australia that many countries where we thought we were able to get nurses from, now there are restrictions on those people travelling to Australia. So it is a matter of urgency.
And can you step me through, for residents in aged care, why does this measure matter, this 24/7 nursing?
Well, the situation that you have where I'll give you an example. If someone is in aged care at the moment and they are having difficulty breathing, I'll give you a real example. Someone's got COPD. They're in a panic state. They're starting to have difficulty breathing. If a nurse comes and looks at the person and says, look, okay, now let's get your nebulizer out, let's just calm you down, let's relax you, let's see if we can keep you there. And they actually take that person, they reassure them, and that person's panic and anxiety is reduced because they've got a nurse there actually helping them through that situation. What happens in many cases now is that the person who's on duty that night might just say, well, look, let's put them into an ambulance and send them into hospital. And I know, once again, this is a real case I'm saying. The person goes into hospital. They may spend 3, 4, 5 days in hospital. That costs money to the health system, whereas the person could have been dealt with on-site at the aged care home, at the nursing home, and not had to have that unnecessary trip to hospital. And this is one of the reasons then, of course, other issues that are around is that if you are talking about someone at night, often people with dementia may be wandering around at night. If you have a dementia care nurse that can actually, that's trained in that way of dealing with people that can actually be of great value as well. But I go back to that fundamental principle that you would not have a hospital without a nurse there at night, and yet you've got aged care homes with up to 100 people in them, and there's no one there at night. But I know that a lot do, but I don't know the exact figure, but I believe that they said that 20% of nursing homes are not able to have a nurse there at night.
Ms Edmonds, did you have a perspective on this question about the importance for residents of this measure?
Absolutely. It is essential for residents, as Ian said, just in terms of care, in terms of quality of care, in terms of knowledge and understanding of particular conditions and issues. We know that older people are entering aged care more frail, with more chronic conditions and more complex conditions. So it's absolutely essential that they have the matching clinical care there on hand that can assist them. And I agree with Ian. I mean, people don't need to be sent off to hospital or don't want to be sent off to hospital from the residential care facility. So having a nurse there enables that person to stay in that environment where they feel safe and they feel comfortable.
Thank you. You provided some evidence earlier to Senator Rice around home care fees and some fees being charged to people you represent. I'm just interested in why the measure to cap home care fees might be important, and if you have any other examples of the types of fees that you've seen charged to people.
It's important because it's about setting clarity for older people. At the end of the day, it's about setting clarity for older people. So if they know exactly how much they will be charged or what the cap is on that charge, that gives them some surety of the money that they will have in terms of their care and services from that package, and knowing what their provider is doing and if that provider is doing it within a legislated, regulated way. At the moment, because it's so disparate and different across everywhere, people don't know, and so that they sort of see their charges and then they see someone else's charge something else, and it can causes obviously a lot of anxiety and stress. It's cutting into people's packages. So, as in the example we put in our submission, ending up with $900 to get your care and services from $9,000 is a bit excessive. So, having those protections in place to protect older people so they get the care and services they need is absolutely essential.
How do you think providers might react to the capping of fees?
I think some will react negatively, but those that have already sort of perhaps got fees may respond positively to that. I guess our concern in that area is those that do have lower fees may consider this an opportunity to increase other charges, to increase those fees up to the cap, because they might see that as the maximum rather than, they might see that as where they need to go, as opposed to you can charge any amount in between. So I think it's really hard to say. I think that it will definitely be a mixed response depending on where the provider is at this point in time.
So what do you think the government could do to ensure costs aren't shifted, for instance, to prices for services like care or domestic help?
I think there needs to be really good monitoring processes in place. I think it needs to be made very clear that the capping of fees doesn't mean that then other fees can increase exponentially. And maybe there needs to be consideration of what is a reasonable fee for different services and charges, and then anything above and beyond that can then be questioned or, gives the older person something to sort of work with, and gives an advocacy organisation like Open something to work with. So I think it needs to be really clearly stated that, while these fees are capped, it doesn't mean that other fees can be let loose. There needs to be some controls around that, some monitoring around that, and some reviewing around that.
Okay. Mr Henschke, did you have a perspective on those two questions about home care fees?
Yes, I do. I find it very curious that the Royal Commission was able to go into all this information more than 2 years ago when home care packages were looked at the Royal Commission, and they found that you could get a level 4 package, and some people were getting as few as 9 hours, and other people were getting as many as 16 or 17 hours. So you were almost getting double the amount of care for the same package. Now, that's not what you would call within the realms of reasonable variation. Clearly, either one provider is being either incompetent or has an overly high cost of management to be able to do that, and the other provider is obviously being efficient. So you can't really have a system where you would have that much variation in it. We wouldn't accept that in other services in our community, but this, you must remember, is taxpayers' money that's being provided, to the provider or to the individual, and then the provider takes the money out of it. So how can you have that sort of discrepancy? That was what was discovered in the Royal Commission. Now, I spoke to one provider who told me that he is a for-profit provider and he is providing more hours of care than a not-for-profit provider. The not-for-profit provider is able to take advantage of all the charitable concessions that are available to them to operate their business, and yet they are providing fewer hours of care per week than the for-profit provider. So that shows you that there's another distortion in the system. So we have to look at transparency. And when you do talk to a provider, they will say to you, I can run a home care package on around 15% of management fees in a level 4. You know, they'll tell you that's what they can do. So why would someone be charging 40%? So this is why you have to ask yourself, what is really going on? And have we got a system that is rewarding efficiency, or are the people who are actually doing that, what you would have to say, they're either taking excessive amounts of money deliberately, or they're inefficient and they're taking excessive amounts of money. Either way, they're taking excessive amounts of money away from people. And then when people don't get the care in their home, they are forced to move into a nursing home or an aged care home. And National Seniors surveyed its members, and we found that almost without question, 90% of people say they want to stay in their home for as long as possible. And people will even spend their own money to top up so that they can actually stay in their own home. Now, if you get a level 4 package, 17 hours of care a week, and there are 7 days in a week, you can get a couple of hours of care per day, and with family and carers and other people coming in, you may be able to stay in your home and avoid going into an aged care home. If you get 9 hours of care a week, then you actually are at a point where you are frail, you need that extra care. So the provider that's queuing up that money in management fees is actually creating a poorer quality of life for that individual. And that is why we come back to the issue of transparency again. How can a for-profit provider provide twice as many hours of care as a not-for-profit provider in the same city, providing the same home care package with the same number of costs? What's going on?
Mm. And Mr. Henschke, why do you think some might resist more transparency?
Maybe people don't want to have exposed what's going on, because the point is, if somebody is making money out of the system and they are actually making an excessive amount of money out of the system, that's probably why they don't want to have the transparency to come through and have a look at it. I've heard of other providers who charge in unit blocks of 45 minutes, so that when instead of providing hours of care, they're providing units of care. So even by doing that, they're taking 25% of the person's package. They're saying, oh, we're going to give you 8 units of care on a level 3 package or whatever. You see what I mean? It's 8 45 minutes. So there's ways that they're doing it. That's why you have to have the transparency. because I get back to the point, we are spending as a society, I think it's somewhere around $24 billion a year on aged care, which includes home care in that amount. It's up to us, both as people who are involved in the system, to say, well, it needs to be as transparent as possible. And the providers need to recognise that that money that's being given is being given by government, and it's there to help people live out what is one of the most difficult periods of their life, their end of life. And if they're taking money away from those people, they're taking away the quality of life away from those people. And if they're doing it to make unnecessary profits, I think we have to recognise that there's got to be a reasonable amount of profit so the person can actually get a return for their investment. But we should be able to work that out. And if someone's making more than that, they're making a unconscionable amount of profit out of it. And that's where I think government needs to have a very close eye on what's being done both in residential care and in home care.
Mm. Thank you,
I just
Mr.
want to
Hinch.
mention one. I want to mention one quick thing. The recommendation 88.2 of the Royal Commission was that there should be a change to the Freedom of Information Act so that you can actually see what's going on. And I think that's important, that we do actually shine a light on this, because in residential care, 80% of the money is government money from the taxpayers and the rest of it comes from the individual. So this is taxpayers' money in both cases.
Mm. Thank you, Mr. Henschke. My last question I'll put to both of you. What information do you think needs to be included in reporting to improve transparency on the performance of the sector? Are there specific things you'd like to see in that information?
Sure, I'll go first. We'd like to know, in addition to what's been suggested, is details of the provider's related party transactions, such as transactions between approved providers and a member of their key personnel. We'd like information on staffing levels, qualifications, hours worked, employment status and turnover. We'd also like information on service provision and use. So that's both for home and residential care. So it could include the number of residents or number of older people on their books who entered and left the service and the reason for leaving the service, as well as the average number of people remaining on the service. And we'd also like information on the number, type and outcome of complaints. We also think that it's really important that there's inclusion of the information of outcomes of quality reviews, enforceable undertakings, SIRS incidents, Serious Incident Response Scheme incidents, and reporting on the provision of services to people who come from diverse and marginalised groups. Now, we know that a lot of that information can be found in various spots, but we think that for, good transparency, useful transparency for particularly for older people that might not be online and can't go searching out all those areas, that all this information is gathered in one transparent and accountable document that everyone can access.
Thank you. And Mr. Henschke?
I agree entirely with that. You need to know the staff to a resident ratio, and to just take a prime example, recently the government said that it was providing $10 extra per day per home so that you could actually have better quality food in those homes, and yet you can't actually see whether that was being spent and where it was being spent and which homes didn't spend it on food, because there was a report that came out that said that a certain number of homes didn't actually meet that requirement. We need to know who those are, because I come back to that point again, people to make informed choices about where they're going to, if they have to go and use a service, they should know whether that service has the ratio of nurses to residents, and what they're spending on food, and those other arrangements which are obviously crucially important. I mean, we saw an example of a nursing home in Melbourne which had a rental arrangement where it was renting the property that it was on off a second entity and saying that was a large part of its costs, and yet the rent was nowhere near what you would have considered to be a market rent. I think there's got to be a lot more checking of what is actually going on, and not just saying, well, there's your money, run your nursing home.
Thank you, Mr. Henschke. I think Senator Pratt has a follow-up to this line of questioning, and then we'll come to Senator Ruston as well.
Yes, thank you. There was a statement, I can't remember which witness, that spoke about particular transparency of complaints and reporting about complaints. That resonates with me because I've had a number of constituents who haven't been satisfied with the complaints process in terms of the information that they were provided, and the information about the investigation that took place and the eventual outcomes, and that they found they were all too generic at the end. And I wondered if you might give me a little bit more detail on what kind of oversight needs to happen there.
That was me. So we hear that as well, where people aren't getting informed or aren't getting informed of why a particular outcome has been decided. I think if we're going to have transparency on complaints, there needs to be information on what the complaints were, how that complaint was handled, and then what the outcome was in terms of that complaint. So was there actually action taken? If not, why not? And then if there was any follow-up needed further on from that, did it become a rolling complaint? Was there a one-off, or was it something that then became an ongoing issue, and what happened in that process?
And people often don't have an understanding as to whether there are related issues in the aged care home in terms of being able to hear back in the context of their complaint whether there are systemic issues or if it's a one-off. How would you draw those threads together?
Look, I agree. I was just thinking that as you were talking, it is about that systemic issue, not only for the older person, but, if you're getting a number of complaints around a similar issue, then, you need to look at what's going on for all those older people, and you need to draw that systemic sort of thread together to understand what's happening. But you're right, older people themselves also need to understand, I'm not the only one that's raised this complaint. There's a whole bunch of us there's a whole group of us that have said this. We need to be able to talk together and maybe see, well, what's going on, that we can share that information and actually help improve services as well.
And is the current categorisation and the types of complaints in terms of how they're logged, etc., are they too generic to achieve that effectively, or can that be better done?
Again, I think it depends on how effective the provider is and what sort of level of, maturity they have in terms of responding to complaints. Some it is that generic kind of, this was raised and this was the outcome, rather than that level of detail where you can actually do a bit of a systemic analysis of what's going on within your service. For others, they do have a lot more detail there, but I don't know if that then means they then look across and go, oh, actually that's coming up in lots of different areas. It's really hard to have any transparency on that.
Yeah, and also can I ask, do residents' health records end up inside My Health Record, or because they're now being managed within their aged care home, are we no longer getting that data and oversight across the whole country for what's happening for residents with health issues and falls, or a whole range of different things?
I'm sorry, I can't answer that question. I don't have the knowledge about that.
Well, is My Health Record used in our aged care facilities currently very much?
Again, I'd have to go and find out. I'm sorry, it wasn't something I'm across.
Okay. No, that's fine. I guess I'm just trying to paint the picture of when you try and look what's happening for an individual person being cared for and their health and well-being. Who's got a whole picture of that and where does that exist? And I'm not sure the extent to which my health record is playing that role, but I will, I guess, look into that in a different context. Thanks.
Thanks, Senator
Yeah, look,
Pratt. Senator Ruston.
sorry, apologies. I agree. I think, in reality, regardless of where the health information is kept, the provider should have that information be across all that.
Thank you.
Can I just say one quick thing that came up very early on, and that was one of the reasons the Royal Commission was actually triggered was because of the Oakden facility in Adelaide, and the lady that prompted that inquiry said that she wanted a plain English, user-friendly complaint system that wasn't solely online. And they wanted a red flag trigger at hospital level if an aged care resident was found with unexplained bruises. I mean, these are some of the things that people have asked for, and I think these are the things that need to be looked at. And the other thing that came up, of course, was to improve aged care. The previous minister said that they were going to have CCTV in areas of homes as well, and I don't know whatever happened to that. That would help improve the level of care as well. And that was Minister Wyatt rolled out, I think it was a $500,000 trial with CCTV, but we don't know what happened to that.
Senator Ruston.
Thank you very much, and good afternoon. And thank you very much, Ian, for your advocacy and shout out for the work bonus and getting older Australians, particularly older Australians with health training and experience back into the workforce. So obviously very keen to see that happen, and thank you very much for your advocacy on behalf of those older Australians. Just keen, Ian, in your submission, you raised concerns around the ability for parliamentary oversight on issues of RN exemptions, caps on charges, and also around the details on the information required under transparency. Just wondering what consultation you've had with the department in relation to your concerns about the lack of transparency that appears to be happening here around these really important details that sit under this legislation.
We've put the submission in, obviously, and we also put submissions into the Royal Commission, and I think a lot of people were hoping that the work that they did in the Royal Commission would result in recommendations that would be around transparency as well. So that's been the engagement.
So you haven't had any engagement with the department subsequent to the decision by the government to put this particular piece of legislation before the Parliament in relation to the details that sit underneath the three schedules, because it seems to be a bit of a trend through all of the submissions that we've received that there is great uncertainty and a lack of transparency around the details of the exemption, the details around the application of the caps, and the details around the information that is required under transparency. So I was sort of keen to understand, have you had any discussions with the department?
No, I've had no discussions about the exemption, specifically what exemptions would be there. So, and we are taking the view that that if you're going to be involved in the care of older Australians, that we think that this idea of an exemption is actually problematic from fundamental basis of it is problematic.
So obviously, ipso facto, you would like to see the details of any subordinate legislation so that there'd be clarity. So can I ask the same question then to you, Ms Edmonds? Would you like to see the details that sit underneath this legislative framework, I think is probably the best that we could refer to this bill as, the details that sit under it that actually are going to be the mechanisms and the details of delivery of these commitments?
Absolutely. I think it's absolutely essential that we and older people see the subordinate legislation and see what's going to be included in that, and be given an opportunity to actually, raise concerns if there are concerns or provide feedback on that.
Yep. So, to question to both of you, would you like to see this legislation put on hold and request that the government provide us with the details of this subordinate legislation so that you can have clarity and certainty that what is contained in that subordinate legislation is going to be fit for purpose and actually deliver the outcomes that you want to see delivered for the older Australians that you represent?
I don't know about how long we can delay a lot of these things. That's my concern.
But you can't, Ian. I mean, my point would be that this legislation is completely and utterly ineffective until the subordinate legislation comes into place. Unless, of course, if the subordinate legislation doesn't come into place, then there's no such thing as an exemption. My argument would be, and this is why I'm seeking your views as the experts, that in the absence of seeing this legislation, the subordinate legislation, what is the point of this legislation?
Well, I would see the point of legislation that it's actually taking some steps forward and putting in the framework as was described to start that process to bring in the subordinate legislation. This is sort of the overarching. This is what we're committing to. This is what we're going to do as a government, which older people want to see happening, and then we see the details in the subordinate legislation when it comes out.
So you're comfortable with not knowing what the government intends to do in relation to exemptions, how they operate, how the caps are determined, and the kind of information that is going to be required under transparency. You're cool not to know that when you're voting on the framework legislation that sits above it.
We're taking the presumption that the subordinate legislation will be put out for review and consultation as with any piece of legislation, in which case we can then make comment on that.
I'd be happy with
We'll
that
certainly
too.
be asking the department that in a little while, but you do realise that subordinate legislation as a general rule is unable to be amended. So whatever the government chooses to put in is either accepted or rejected. So you're taking a blind leap of faith here. But anyway, thank you, Chair.
Thank you, Senator Ruston. Thank you both Mr Henschke and Ms Edmonds for participating today. We appreciate your evidence.
Thank you very much.
Thank you very much for giving us the opportunity. Greatly appreciate it.
I'd now like to welcome via video conference representatives from the Australian Nursing and Midwifery Federation and the Health Services Union, who I believe should be online. Thank you for appearing before the committee today. In the interest of time, we're asking our witnesses to table their opening statements. Are you prepared to do that? Great, thank you. And I'll just confirm who we do have on the line. If you could just state your name and the capacity in which you're appearing.
Lauren Palmer, appearing on behalf of the Health Services Union.
Do we have Ms Bellino on the line? Okay, I think we're still waiting on Ms Bellino. Senator Rice, I was going to pass to you. Are you comfortable to proceed with questions for Ms Palmer while we wait for our next witness?
Yes, look, I'm happy to start. The ANMF like to respond to my questions as well once we get Ms Bellino on the line.
Well, if it assists Senator Rice, Senator Ruston, did you have questions for these witnesses? Oh, here we go.
Question was around the consultation that has.
I don't think we have your audio, Senator Ruston. Waiting on Ms Bellino. Senator Rice, I was going to pass to you. Are you comfortable to proceed with questions for Ms Palmer while we wait for our next witness?
Ms Bellino's on the call, on the WebEx, she just arrived. The ANMF like.
Okay, I'm having some trouble with my WebEx. Am I the only one? I can hear myself in the past speaking. Okay. Not sure what's been happening in the room the last few minutes, but I'm going to pass to Senator Rice, and I believe we've got both witnesses online now.
Okay, let's see if this works. People can hear me well enough now. Thank you both for your submissions and for appearing before us. Starting, Ms. Bellino, in the ANMS submission, you noted that, as we've been discussing, that many of the details around implementation of the bill's intended reforms will be outlined in subordinate legislation. Without access to the subordinate legislation that we introduced by the government, the ANMF is limited in its ability to make full comments on the details of this bill. So I was wondering whether you could expand on your concerns and what your position is on the details and exemptions in particular being set out in delegated legislation.
Thank you, Senator. I think it is, we deal with it a little bit in our submission. Of course, we are completely open to participating in discussions about the subordinate legislation. And we do think that that's an important process, and, we think it will take a little bit of time. But, similar to the previous witnesses, it's important that any form of exemptions be limited from our perspective. They be time limited, they be transparent, so that those providers who do get exemptions can't just continue to get exemptions without showing that they've got a plan in place, that they've genuinely tried to recruit the workers that they need, the registered nurses. So it's really not so much around, we understand that, the current situation is that there's likely to be a need for exemptions, but we expect that they should be, there's some caveats with it, they should be limited, not be able to roll over all the time, genuine attempts to employ and recruit registered nurses. We do also think that, genuinely, and I think it is in some of the documents already, with particular respect to rural and remote residents, they do have a right to decent healthcare and aged care as much as those in the cities as well. So we are very keen for this process to be implemented and start the process of reform and improvements to care for residents in aged care and for some hope for workers as well, quite frankly.
Yeah, so, do you think it's fair on people living in aged care homes in regional and remote areas that there is an exemption because of the worker shortage, essentially? So it means that they're getting a different quality of care than if they're in urban areas.
Well, I think there's 2 points to that. Do I think it's fair? I think our submission says that they deserve equal access to healthcare as everyone else. Given the current situation in aged care, given the last 10 years of neglect that we've had in aged care, we do think that it will take some time to change the sector, to improve the sector, give workers some hope, and to bring back the workers to the sector. And that will take a staged process. That our members tell us that with better regulation, with RN 24/7, with minimum staffing levels, with more nurses and more time to care, and with wage increases, that they would be happy to come back and work in aged care. So I just think it's a staged process, and this bill just starts that process of reform and change.
So what else does need to happen to increase the number of registered nurses? The Providers Association earlier on today estimated that from the implementation of 24/7 nursing care that there need to be another 1,400 registered nurses being employed.
Well, certainly from our perspective, stalling any reform in the process is not what should happen. It's exactly the opposite. We need to give our members, workers and the residents some hope that there are improvements coming. They have worked through the pandemic, they're tired, it's physical, it's emotional, but if they feel like there's some hope coming and there's some change, then, that's a great start to improvements in aged care. We surveyed our members earlier this year on what would encourage them, what would help them come back to aged care or work in aged care again. And they told us that almost 80% of that survey said if there were minimum staffing levels and skills mix guaranteed, then they would love to come back and work in aged care. More than 70% said that if there was a requirement for at least one registered nurse on site at all times, then it would help them make a decision to come back and work in aged care. And 50% of those surveys said that if there was a 25% wage increase, then they would work in aged care as well. And I just don't think there's one thing, but there are a whole range of compounding things that all work to send a signal to workers in the sector, workers who want to come and work in aged care, that things are going to get better and that there's some hope.
And given those nurses that would come back, and this is, do you think even with that there is going to be, or there is a shortage of nurses across Australia, and do we need to be doing more in terms of training and encouraging people to become nurses?
I think that's a very good question, and of course there is a shortage. There are also a lot of nurses in aged care who work part-time, who with improved conditions, better regulation, more nursing staff, other staff to help, like the care workers and ancillary, who actually would be encouraged to work more hours as well. And I think that's often overlooked in aged care. We just accept that people are part-time, but in fact, with improvements, they actually may increase their hours as well. We all know that aged care is, not just chronically understaffed, but underpaid, and it all sends a signal that the workers in the sector are aren't very valued in the community. But we do think this will change. There does need to be more change, improvements to training of nurses. It's not my specialty, and I can provide some more information on that, Senator, if that helps. But each and every step that we make to improve standards, to improve staffing, to provide more time for direct care helps the process of bringing nurses and more aged care workers back to the sector.
Okay. Look, my final question to you, and then I'll also ask Ms Palmer to respond to it, is going back to the delegated legislation. Do you think that you've been adequately consulted to date as to what's going to be in that delegated legislation?
Look, to be fair, I wouldn't be the person who would be consulted, and unfortunately our federal counsellor is on today, so our federal secretary is not able to be here. But we've certainly put in our submission that we are very keen to be further involved in the drafting and the design of the subordinate legislation. We think that it's crucial legislation because it does outline the care minutes and the composition of the workforce that will be required, the number of enrolled nurses, registered nurses, personal care workers, and the direct care that they will do as well. So to be fair, I'm not sure about your question, but that we are absolutely keen to be much more involved in the design of that subordinate legislation, Senator.
Okay, thanks, Ms Bellino. So, Ms Palmer, what consultation have you had to date so far, both with this legislation and also the subordinate legislation?
So, similarly to Ms Bellino, that would probably go to a higher power than me within the organisation. But in saying that, I think there's two things of note here that the government made introducing this legislation a top priority does instill quite a lot of confidence in us and certainly in our members who are taking it to be finally being seen. It has been an immensely difficult time working through the pandemic, and that follows a sector that was really already in crisis, as the Royal Commission outlined. So to finally feel like the workforce recommendations of the Royal Commission are being paid proper and due attention does give us a lot of confidence, and we think it's really important that we move on this and move quickly, and we think the government is doing that. So in terms of the details and the consultation, there is an element of confidence there that stakeholders across the sector will have a chance to share their views, and we hope to be a part of that. It's important stuff, and we think the government will do the right thing.
Okay. And what else needs to happen to implement the recommendations of the Royal Commission with regards to care minutes and workforce?
Yeah, so obviously the Health Services Union, our members are predominantly personal care workers, and then in those really essential supporting roles of food services, laundry, cleaning, and we also cover allied health professionals. So we recognise that the continued implementation of Recommendation 86 for the full round of care minutes is really important, and this bill will give effect to that. But we want to also make sure that allied health professionals are embedded in staffing and care profiles, that they're supported by sustainable and adequate funding to be pulled back into the sector. They're not currently resourced well enough to be a really regular part of care models, so we want that to happen. And we want to make sure, particularly as the rest of Recommendation 86 is implemented, that we have really clearly defined roles so that there's no substituting anywhere of having someone in food services doing care work and that counting towards. So there's some regulations around that need to happen.
Can you tell me, expand more on what your concerns are in terms of the gap in funding and what needs to happen to ensure that allied health professionals are embedded in care?
Yeah, so there were two Royal Commission recommendations that recommended a dedicated funding stream, and I think off the top of my head that's Recommendation 36 and 38, but please fact check me on that. It's a big final report, but something that can provide dedicated funding to ensure allied health professionals are counted back in. There are some concerns that we have with the ANAC and with any future model that allied health will be cut out of staffing profiles. So I guess we'll have to see in some ways how that rolls out, but we want to make sure that there's dedicated funding. Allied health professionals are so important to preventative and restorative care, and it's essential we have more of them in our aged care services.
So with your position that there should be sort of mandated minutes of care like there are with nurses for those allied health professionals?
Yeah, down the track, that is what we think should happen. So, I mean, first and foremost, we'd like to see the care minutes model implemented, and then we can look at adding additional funding and resources and mandates for allied health.
And have you got other experience of your members of allied health being cut out as the new ANAC funding model is being implemented, of losing work at facilities?
Yeah, there's certainly concern. We do have allied health members who are worried that the funding won't continue to capture them, but we'll have to wait and see, really once that's fully implemented. But there is concern that may happen.
Okay, thank you. Thanks, Chair.
Thank you. My first question is to Ms. Bellino. Can you explain to the committee why having nurses on site 24/7 as part of minimum staff time standards is so important, and what the consequences are of not having this measure in place?
Thanks, Senator. Well, I think the first point was it's the care that's missed, that is lost the most from residents. So there are things like falls, there are things like medication errors, there are all sorts of things that happen when a registered nurse isn't there, particularly at night times. And the consequence of that is that the resident is left until an ambulance is called, and then they are taken to hospital. So there's the flow on of cost to the public health system as well. But residents have, unnecessary pressure sores. They have all sorts of the lack of medical intervention and ongoing preventative health that would be dealt with if nurses were there, and not just one registered nurse, which I think is the important thing. It's that's the sort of minimum, and we're thankful that that's coming in, but enough registered nurses to deliver the care that facility and those residents need. And so I note that there are, the care minutes are increasing as well. So it's the preventative health care that a registered nurse is trained and competent to deal with, and, in a speedy manner.
Thank you. And Ms Palmer, the 24/7 nurses forms one part of the care time standards, including the 200 minutes of care from October 2022 and 215 minutes of care from October 2024, which were part of the ANACC bill. Can you talk to us about why you might think care time standards are important for both workers and for the older Australians they care for?
Absolutely. I mean, our members will tell you that there are just simply not enough people in residential facilities to offer the care that older Australians deserve and that our communities expect, and also that our members want to deliver. They want to have time to spend getting to know residents. They want to be able to offer care in a way that is safe to both them and the person receiving care. So, we support 24/7 nurses, absolutely. But it's got to come with, in addition, extra staff across the spectrum of the skills mix. Enrolled nurses, personal care workers, there needs to be more of them available to provide care. It's really, really important. And it will be really important to make sure that what we mandate actually happens on the ground in residential facilities.
Thank you. Can I ask you both for your views on the exemption, whether you think it's needed, and if so, how it should be designed?
Yeah, the HSU is happy for there to be an exemption. We recognise that there will be instances where an exemption is required, but Ms Bellino touched on this earlier. They need to be very well drafted. There needs to be a high threshold and a demonstration from providers that they've pulled every other lever available to them to try and meet the care minutes model. So it must be truly exceptional circumstances, and they should be time bound. Where there is an exemption that expires, it would be a good idea if people are reapplying or making applications for a number of exemptions, that there's a review mechanism in place to really understand why a particular provider or facility might be constantly needing exemptions. There's plenty of things you can build in to make sure that they work purely in those exceptional circumstances when they're needed.
Thank you. Ms Bellino, I know you made some commentary on this before, but is there anything further you wanted to add?
Look, we accept that there is a need for a certain period of time anyway to have exemptions, really, and we're happy to for them to be in place, for them to be reviewed, time limits on those exemptions, and for them to be publicly available as well, so that we can make sure that an exemption isn't just being rolled over without a genuine attempt to employ qualified and the right number of staff.
Okay. I just want to move to the transparency of information provisions. What items do you believe should be included as part of their improved transparency of information measure? Perhaps Ms Palmer, I'll go to you first on that one.
Yeah, so we're happy with the categories outlined. We would like to gather some more information and some more publicly available information on modes of employment, so understanding how many full-time, part-time, casual, labour hire, agency are being engaged in facilities, and is there a balance, or an out of balance proportion happening, say, with casuals? Are there, and again, Ms Bellino touched on this earlier, are there opportunities from that data about lifting the number of hours offered to part-time? There's lots we can learn if we have a clearer picture on the contracts of employment. We'd also like to know what is being spent on training and qualifications above and beyond those standard items like manual handling and those sorts of things. We want to know what money is going towards encouraging workers to achieve a certificate, move up a level, undertake specialist skills.
Thank you. Ms. Bellino?
Thanks, Senator. In relation to transparency of information, we're very thankful for the government moving on transparency of information. Firstly, it's important that we acknowledge that we have campaigned for a long time to find out a lot more information about aged care facilities, not just for residents, and I understand the previous witnesses would be talking about from the perspective of residents, but workers also need to know about where the money is going and what is happening at their facilities, because very often they're told that there's not enough money to do certain things. They see that they're working short-staffed, not enough nurses, not enough staff working towards direct care, but they don't know whether there is actually funding going for those services to be provided. So in our submission, we make the point that transparency is also important for the workers and not just the consumers and the residents themselves. So we have listed at point 28 in our submission a number of other points specific to mostly nursing care, just to make sure that the right number of nursing care, the right amount of nursing care is being provided to residents. But as Ms. Palmer has mentioned, full-time, part-time, the breakdown of the casual workforce and the labour hire firms and agency staff as well.
Thank you. And Ms. Palmer, just to that point for you as well, appreciate Ms. Bellino commenting on what these transparency standards mean for workers. Can you just give a perspective on behalf of your members?
Yeah, look, I think a lot of our members feel there's a trust deficit going on that needs to be addressed, and I think a lot of community members and care recipients would feel that too. It's hard for our members to accept further cuts to staffing, not be receiving additional training, those sorts of things, but then not really have any knowledge or oversight as to why. So I think it would restore a bit of the trust that's missing and really give them more opportunities, give the entire sector more opportunities to understand where is money going, remembering it's largely taxpayer money. Where is it going and how can we be better directing it to really build a high quality aged care system?
Thank you. I'm going to pass to Senator Ruston and then Senator Pratt.
Thank you very much, Chair. Thank you very much, and can I acknowledge the amazing work of your workers throughout the pandemic in keeping so many older Australians safe and alive. So thank you very much. I'm just interested in probably in the first one going to you, Ms. Bellino. In your submission, you raised concerns about the subordinate legislation, and you made some comments earlier on in your opening remarks that you'd like to have more involvement in the development of that subordinate legislation. I was just wondering what consultation has happened to date with you or other members of your organisation around understanding the kind of detail that will be contained in that subordinate legislation, because obviously it is extremely important in understanding how this particular legislation will work and how it will deliver for the people that work in the facilities that are members of your organisation.
Thank you, Senator, and thank you for the comments as well. In terms of the subordinate legislation, to be honest, I have to take that on notice, and I can provide that fairly quickly if anyone from my organisation has been involved in negotiations with the department. It's not to my knowledge, but I could be wrong with that. So I'm certainly happy to go back quickly and find out if that assists. But our submission does say that we are very, very keen, and I stress that, to be involved in the drafting of the subordinate legislation, because it is really important to get it right, and it's taken us such a long time to get here to be able to be at the stage where we are going to have a guarantee of minimum staffing levels. So we do want to be very much involved, and we would like time to be involved, not just in the consultation, and make sure that our members get an opportunity to provide some feedback as well. Often that gives us the chance to just check that what we think is right on the ground for our members day to day who deal with this all the time.
You know, obviously you're at the coalface around the challenges of workforce shortages and all of the issues of the last couple of years. Do you believe that the recruitment of potentially an additional, 1,400 or so RNs between now and 2023 is actually going to be achievable? And if you have some concerns about that, are your concerns more directed at any particular area of the sector?
Senator, our numbers are a little bit lower, to be honest, but regardless, there is a shortage, and we do need to be focusing on the recruitment of RNs to aged care to meet the deadline from 1 July 2023. I note that the federal government has supported the Fair Work case for a significant wage increase, and I think that is a very important step. So it will be part of the process of trying to encourage nurses back into aged care. And also, our members tell us that if there were more requirements for registered nurses, if there were more requirements to have minimum levels of staff across the board, more personal care workers, more ENs, it's rewarding work, it's good work, and they want to do it, but they just, can't do it if there aren't all of the conditions that make it safe and enjoyable for them. So that's, I guess, why we have supported that there be an exemption process, because in the long run, there may be some facilities, and everyone talks about rural and remote, and often rural and remote facilities have to compete with hospitals which have ratios already and about 30% higher wages. So, we think that there needs to be a workforce strategy with the government to recruit nurses and nurse practitioners to rural and remote facilities as well. And we have, raised that with the government. But we're very flexible, in trying to do everything we can to improve the conditions and standards and make aged care better and bring more nurses back to aged care.
Yeah, just on that then, would you be supporting under the exemption mechanism, when we eventually actually see it, that exemptions are time limited?
Senator, I think in our submission we've suggested they should be for 3 months.
3 months. So take that to the next step. So are you confident, given the marketplace and the workforce constraints that exist and are likely to exist into at least the foreseeable future, that a 3-month exemption for say for instance a rural small facility that has a very shallow market would be sufficient?
I think our submission also says then there would be an ability to have consecutive exemptions. So it wouldn't be saying that after 3 months, that's it, the facility closes, there's no RN. Obviously, that may not be the case. But it also at 14C of our submission suggests that an exemption, should come with the requirement that the provider develop a plan to manage the exemption, and that it's, publicly available to people as well. So, I mean, that essentially says the provider has tried on numerous times. They've advertised for the position. They've got this number of applicants, et cetera, et cetera. So, you know, we're flexible in terms of an exemption. We understand that this has been going on for a long time. The workforce crisis, it's not going to be fixed straight away. We are not looking to shut down facilities. We're just looking to lift standards.
Yeah, so I suppose I'm just taking to the natural conclusion of this particular point is around, you know, what do you think is a reasonable expectation in relation to actually having 24/7 nurses in nursing homes or aged care homes without exemption?
Do you mean time frame? How long do you think we would get there? I don't have any. I don't have any information on that, Senator. All I can refer you to is, and I'm happy to table it, a document we have produced which summarises information about registered nurses in aged care, the numbers we say that are necessary, and also how many of our members say that they would be happy to come and work in aged care if certain conditions were met, which we believe this bill starts the process of, and that is, you know, requirements for RN 24/7, requirements for care minutes, improved care minutes, and improved wages, and you know, for workers in aged care as well.
And just lastly, has your organisation sort of undertaken any assessment at the kind of likely additional funding that might be required to be able to support the delivery of the intent of this and the other legislation and election commitments that are before us, and the response to the Royal Commission in relation to nursing staff?
Not separate to the figures announced in the election campaign, no, Senator. Not that I know of.
Okay. Thank you. Thank you, Chair.
Thank you. Senator Pratt.
Thank you very much, Chair. I wanted to ask both unions, please, about the experience of the workforce when complaints are made, but issues can be attributable to understaffing, and what that is like for people on the front line in terms of support you've given your members in those kinds of situations.
Look, for our members, it is extremely stressful and really frustrating to work in a system that can set you up to fail if we don't have enough staff, if we don't have good training and qualifications. You know, the workers know better than anyone the effect that can have on quality of care. So, you know, it's both stressful and really concerning for them. It's not a nice position to be in, and they feel disempowered. There's not a lot that a personal care worker on $22 an hour can do about, you know, fixing the number of staff in their facility. So, you know, these are really deep structural issues that require a really concerted response as outlined by the Royal Commission, so that workers and older Australians aren't in that position.
Ms. Bellino?
Yeah, sorry, thank you, Senator. And just to follow up, there has been nowhere to complain to, firstly. Workers have been terribly concerned about the things that they have seen, the situations they have found themselves in, the situations they have found residents in, but largely there has been nowhere really for them to complain to. You know, I hear stories all the time of our members going home crying. The mental and the physical toll is just too much to bear. And, you know, the chronic understaffing, the restructuring that happens all of the time, and the minimum standards that they find that providers are prepared to accept. We only had to see the stories, you know, on our television from the Royal Commission. Many of our members gave evidence to that. It's hard to believe that aged care is like that. And where do they go? And a lot of our members felt like they did complain. They went to the Royal Commission, they stood up, they told their stories. And so I think what I really want to say is that's why, you know, there is relief that there are some changes happening, because it did feel like that there would be change from the Royal Commission, and then the recommendations weren't fully implemented. So I know that there's hope for our members that there might be change coming. There is change coming.
So in that context, what would you like to see in the transparency measures as they are developed?
Sorry, Senator. I think in our submission, we talk about not just the rosters, but what's actually happening, because too often they say, oh, there's the rosters have covered enough people, but there are sicknesses, there are, someone's gotten COVID, there's someone's got the flu, there's resignations, it's more so, about what is actually happening on the ground and not what the rosters just tell you. So I think that was part of what we said when we said we just wanted to be involved in the negotiating and that legislation.
So some of the kind of constituent issues that I've dealt with where, for example, a family might not have been notified about a fall or then their loved one going to hospital or multiple falls, clearly there can be a staffing element to that. I don't have much insight into the how that is reported internally for staff and how staff cope with those kinds of situations. But clearly you've got members that are at the coalface of distressed residents as well as concerned family members. How do we have a transparency and complaints process that empowers both consumers without adding to the stress of the difficult jobs that your members do?
If I could speak on that, I think, there are structures within workplaces that exist that we can draw on, like work health and safety representatives, union delegates, but often it's difficult for workers to want to stick their neck out, essentially. There needs to be a well-resourced regulator who is visible and effective and responsive. And there may be, mechanisms where workers can be more involved.
And so in the kind of situation I'm talking about, then clearly the kind of changes before us should see more resources on the ground that should hopefully mean the system is more responsive in terms of dealing with the kind of situations that you've outlined where you might have a number of critical health incidents going on at the same time, and so that there should be a greater confidence about what really happened and why there might have been a less than ideal outcome, and that staff and families can have confidence in being transparent about that without anyone, the individual workers feeling like they're the ones that have to cop it because of that adverse outcome. What can we do in the transparency regulations around those issues, do you think? And feel free to take that on notice too.
If you don't mind, I would like to take it on notice. Thank you.
Thank you.
Yeah.
Thank you, Chair.
Thank you, Senator Pratt. I appreciate you just agreed to take something on notice. Hate to bear the bad news, but we are seeking responses by tomorrow. So if you are able to provide that information tomorrow, we would very much appreciate it. I'd like to thank both of you for your time today. We very much appreciate your participation in this process. I'd like to now welcome representatives from the Australian Physiotherapy Association and Allied Healthcare via teleconference. I understand both are online now, and I'd like to thank you for appearing before the committee today. Could I just ask you to state your name for the purposes of Hansard?
My name's Scott Willis. I'm National President of the Australian Physiotherapy Association.
Hello, can you hear me okay? It's Alan Blaze, CEO of ASC Health Group.
Thank you. In the interest of time, we're asking witnesses to please table any opening statements they have today so we can move straight to questioning. Is that okay with you both?
That's fine with me.
Thank you very much. I'm going to pass to Senator Ruston first for questions.
Now, I'm all right. Thanks, Senator.
Great. Senator Rice.
Thanks, Chair, and thanks, Mr. Blaze and Mr. Willis, for joining us today and for your submissions. Can I ask you both just to reflect upon what this bill does in terms of increasing care minutes for nurses compared with what the situation is for allied health professionals, and particularly you're both representing physiotherapy, and how that, you know, what the impact of that not having that focus on allied health actually means for care being provided to residents in aged care facilities.
Thank you, Senator Rice. Look, I'll take that on first if you want, Alan. Look, I think it's a great initiative of the government to come out and supply the 24-hour nursing because it's part of a team, and physiotherapy is part of that team, like any allied health is part of the complete team that looks after our aged care residents within the facilities. So from a nursing point of view and from a care point of view, we welcome the 24/7 nurse care, but it comes back to the skill set of that nurse and nurses that are going to be looking after the aged care residents as well. So they need to have that skill set. So it shouldn't be just on numbers alone, but also on the skill sets available for the residents that provide those care. In terms of physiotherapy, we're a little bit concerned, and the reports that we're hearing even today from a major provider telling us that up to 50% of physiotherapists will be let go. There'll be 50% less physiotherapy within the aged care facilities, and there's now, even before 1st of October, when the AN-ACC is coming in, reports that contracts are being torn up and being not renewed, and staff already being let go. And I reiterate that once you lose these qualified staff that have got the passion, dedication and the knowledge of a full scope of practice for physiotherapy, it's going to be very, very hard to recoup that at a short term. And it's a shame that we are losing them in that system, because they provide a great team environment and a great service to our most vulnerable, and we shouldn't leave anyone behind here in Australia.
I just completely support that answer. Thank you, Scott. I know we talked a little bit outside of these forums a year ago about some of the cuts and changes we were seeing, and I'm here in a regional area today. Apologies, I couldn't turn up in person, but I'm here supervising someone from overseas because there's such a dire shortage of physios here in Australia already. As you know, Senator Ross, 6,000 short even before COVID. And just really thank you, Scott, for saying so articulately. We're facing a generational loss of some experienced aged care physios, and that is an absolute tragedy because you just heard Scott say that about 50% of a major provider. Well, I've had my team through the skin of my teeth managing to keep everybody's jobs, and I will continue fighting for that. But it's not been easy. I promised everyone a year ago we'd keep their job, and I still keep that because we can go and work in another area. It'll make more money, you know. We want to work in aged care. We want to stay in residential nursing homes, and we can't the way this is playing out right now. And that's absolutely a tragedy. And you can read all the detail of how that came about. But if I have to explain to a lovely lady like I just had, and I'll call her April, with dementia that I just saw, why her lovely physio is not coming around 4 times a week anymore, yeah, you don't care about the policies and the stats at that point.
So what needs to change? Then obviously we've got some steps forwards with improving the availability of nursing care in aged care homes through this legislation. What needs to change to ensure that, yes, your resident called April, that she will be able to maintain a visit from her physio 4 times a week?
Right now, April's got no choice, Senator Rice, and I know everyone here has older parents, and April reminded me a lot of my mum-in-law, who's in a nursing home next to one in a village and would have to go in. She's got choice right now because she's in the home and she can access physios through a variety of funding. She wouldn't have choice if she, after the 1st of October, goes next door and goes into the nursing home. So there is one call that we had previously made and supported as well. But just to state for the record, I'm not representative of over 30,000 physios that my esteemed colleague here is, and the APA, as I'm a member of as well, do an awesome job. But we're equally not talking for all allied health, the occupational therapists, all allied health and what they want and need in terms of certainty. What I can tell you is that there is no certainty for allied health, and that's what I've heard from absolutely every allied health professional group and every person I've talked to. And I suppose certainty is probably a better outcome than not having certainty. Even what Scott just said about someone coming to them and cutting 50%. I've had literally my team leader in this place I'm in, and this is a man who knows me very well, who I share absolutely everything with, and he has now twice told me that, isn't physio still continuing? I read the Department of Health website and that's what I see. And I'm saying, I won't use his real name, I'm really sorry, this is not how things work in Australia. That's what we're being told, but the brutal reality is we're going and we're getting out of this because we can't fight this. I've got contracts cancelled too, everybody does. There's no such thing as a contract that will survive October 1st. So if certainty would have been a lot nicer a year ago if everyone just admitted that, than played a game of will we or will we not stay in aged care? So, Scott, for you.
Yeah, so Mr. Willis, what's from the view of the association, what do you think needs to change to maintain physio services for people?
Yeah, look, a very, very good question, Senator Rice. Look, we're willing and have been working with the department as well as the government as well. And look, I think there needs to be an additional mechanism to provide mandated targeted allied health services. Just to really ensure that delivery of that restorative and reablement care that the Royal Commission identified as critical for maintaining that quality of life in our older citizens within aged care facilities. So at the moment, there's no real minimum benchmark for service provision for allied health and especially physiotherapy. So, I think there needs to be another tranche of legislation that really looks at allied health and physiotherapy, of course, is part of that. And when we hear, as you said, Alan, we represent over 31,000 members of physiotherapy, and we're getting, 5,000 of those members telling us that they're going to be losing their job in the near future. It's a bit of a concern, but from a movement forwards, the Australian Physiotherapy Association would really recommend the Senate committee to recommend that there is some type of benchmark, a minimum benchmark, minimum mandatory requirement of provision of service for allied health and physiotherapy included in that.
Can this wait? I mean, it's not included in this bill. It wasn't included in the bill when the ANAC was set up, the bill that's just gone through the Parliament. Can this wait until the complete new reformed aged care bill comes in, which maybe 12 or 18 months down the track? What will happen if it's pushed off till then?
Yeah, look. My main concern is the loss of manpower, the loss of actually some very good qualified physiotherapists or allied health practitioners that provide a quality and safe service to our most vulnerable in our aged care facilities. My main concern is the quality and safety of those residents living within those facilities, and if they haven't got the quality access to those services, I just have grave concerns of their safety within the facilities. We can put some nurses and more care staff and pay them well, but this is a teamwork. This is a part of a team, and if you take part of that team out, it's not just the team that suffers, it's actually the sector. and it's the aged care sector that will actually suffer, as well as the consumer or our most vulnerable. So I think if we wait 12 to 18 months, that's a possibility, and we're willing to work with the government and work with the department. But my main concern and grave concern would be the loss of qualified physiotherapists to other sectors, and you may not get them back in the short term.
Can you expand on to the importance of having the physios then available as part of that multidisciplinary team? Because we heard earlier evidence from the providers that just having an RN on call 24/7 actually won't necessarily meet the care needs, depending on how many residents there are and what the structure of other care that's available for residents is. Have you got any real world examples of where having a nurse available actually isn't going to solve the health problems that are being experienced by people?
Yeah, look, I think physiotherapy's got quite a broad spectrum of scope of practice. If you look at some of the scope of practices that we as physiotherapists or allied health professionals can provide is just simple things like falls prevention and reduction, building your strength, even continence management, ensuring that that the continence of our most vulnerable is looked after, the balance, the mobility, rehabilitating them after they've been to surgery or an incident after a fall. You've got pain management, you've got gait reablement as well. You've got that mental and physical well-being of the resident that physiotherapists and allied health professionals can actually provide. So it's not just about pain management that was probably you saw under the ACFI funding. We're opening up that scope of practice that physiotherapists but all allied health professionals can provide, and it's such a huge wide spectrum and scope of practice that is so required within these facilities.
Can I just add to that,
Yes.
Senator? I think I can understand completely where Scott's coming from. I agree with all of that. I suppose I remember come back to a question you asked me when I was here a year ago of when would it be too late. I remember that question because I really had to think about that, and I think I said by February it would have been too late of 2002. It was too late after that, and it is too late now to reverse what we've got, which I said a year ago was the death of allied health, and this is what we're facing in 6 weeks' time. The issue for me is more than the effect on physios or allied health in our jobs, and I guess that's what happened. Is it became almost behind the scenes a common story that this is just a physio problem or an allied health problem, because we implicitly or otherwise agreed with the system we were working in. And I know that we all spoke out and said it, but we still worked in it. And whether it was perverse or not, we worked in it. But what I think really, in answer to that question you asked before about when's too late and what will happen in 12 to 18 months if funding does or does not come in, that's coming back to what I was saying before about certainty. Sometimes you're better off to say something rather than hold out for something that may or may not happen. I've heard that, I'm just a physio and I run a small company, but I have heard that we have some pretty severe financial things as well. Senator Pratt, I know that you've talked to a person I talk a lot to, Amina Ship from Aged Care Reform Now, and she kindly passed on the details of her mum, for example, and the effect that physio had keeping her alive and walking for another 9 years after she was rehable. I mean, these are real stories, we know this, and when we come back to that, it's a bigger issue than whether our profession, we'll have jobs, we'll work somewhere, even those 5,000 jobs. I really, really hope they all find another job very quickly, because we have a shortage, and as long as they're skilled and qualified, they should be able to. But honestly, we're not going to die, okay? But that is actually what's going to happen. Scott, I know you've shared and I've shared, and thank you, Senator Ross, for sharing it, some very good research from the Australian Physio Association involved in that showed 55% of falls can be prevented by having a physio, up to. That is a massive number. You've got 5,000 people dying every year from falls. It's the leading cause of mortality for older people. A fractured neck of femur and being in a hospital and then discharged into a Prince's chair is a surefire recipe for death, and not a good one at that, within 6 months. So this is real stuff. If you don't have physios and allied health on the floor and we're being replaced by cheaper, unqualified therapists acting outside of their scope of practice, this causes a real and imminent risk to a nursing home, a board, an executive, a government that is seen to allow this to happen, because this is happening in plain sight We can't say that this wasn't warned about. It was, and we've all been raising this concern for a long time, but the silence has been deafening about what's going to happen to allied health. And here we are, the thing that we predicted a year ago strangely happening. Yeah, I'm not surprised, but I am sad.
Senator Rice, I'll give you another example where I think the sector might be in a bit of trouble, and that's the health sector. As Alwyn said, if a resident falls and breaks their fractured neck or femur, they're in hospital to have surgery and possibly up to a week to 2 weeks of care before coming back to the nursing home. We've already got a significant increase in waiting list for orthopaedic cases and bed blocks Australia-wide. And I can tell you here on the northwest coast of Tasmania, it's no different. And I think if you continually have some nursing home residents coming back into the hospital system for surgery, then your waiting lists are going to blow out even more. There's going to be more ramping, and it's going to impact the whole health system, not just aged care. And it's a real concern for not just the health spend, but the community health and wellbeing as well, and safety of the residents within an aged care facility.
Could I just ask, and I'll finish up with this, because certainly hear you loud and clear about needing to have the access and the fact that facilities are cancelling contracts. But for something like that, if there was a clear need for a resident coming back out of hospital into a nursing home that they needed physios, wouldn't they be able to sort of, bring that service in, or is that just not going to happen if you haven't got the physios servicing that nursing home?
Yeah, look, it's a really good question. I think if you have a look at why GPs aren't coming into nursing homes anymore, is because of the cost of leaving your practice, travelling to the facility, accessing the facility, accessing the resident, and then doing the notes and all that. So it's that round trip of if you're coming in for one resident, it's financially not overly rewarding. You could probably accept that a few occasions, but if you're doing it quite frequently, the amount of cost that you'd have to pass on to anyone would be significant, and it's not sustainable. So if we're looking at a workplace sustainability, that model would not be sustainable at all, and would be quite ineffective.
Thank you. Thanks, Mr. Willis and Mr. Blaze. I think that's really important evidence for our committee to have heard. Thank you, Chair.
Thank you, Chair.
Thank you. I've got a couple of questions relating to the transparency of information provisions within the bill, and I was just interested if either of you had anything specific you thought should be counted as part of the improved transparency in reporting.
You want to go, Alan? You want to go first?
Thank you. I fell a little out of my depth compared to your level of experience, Scott, but thank you for having me here in the committee. As I said, in terms of transparency of allied health, I think it comes back to the definition of what allied health is, because that is a very big can of worms. If we're talking about workforce and accountability and transparency, I see a lot of talking about expectations. I mentioned in my additional information an expectation from the Department of Health of 4% of spend on allied health, and an expectation that Professor Hartland said publicly of 8 minutes per resident per day of allied health professionals, and he defined it in a follow-up question as university educated, APRA qualified professionals, not lifestyle and wellness. The reality is, and the perception could well be from the public and taxpayers, that the person doing the exercise session or the hot pack or the TENS machine, or even as simple as looking over your shoulder, is a physiotherapist, because it might be a physio modality. But in terms of what you're getting and the person doing it, no, it may not be a university educated, APRA qualified professional being counted as the allied health in the expectations. So that is my concern of transparency, is who are the allied health professionals? I know it's defined by Department of Health of what those professions are, but I believe it should be very transparent. If your mum and dad are having an exercise class or anything else, who is the person providing that service? So I hope that answered your question, Senator Brent.
Thank you.
Yeah, from my point of view, look, I think transparency is really, really critical for the success of this new aged care system. And it must include really further specification of what it means in practice as it relates to like physiotherapy more broadly. that allied health provision as well. And like Alwyn said, allied health is a real broad umbrella term that covers a huge amount of, or quite a wide range of different health professions. So I think the reporting must be against each of those professions individually and in detail, just so that we do understand and get a full, clear picture of the levels of care that our older people are actually getting within the aged care facilities. And this reporting, I think, must really feed back into the star rating system, just really to give the consumer some transparency of the full range of services provided to empower their own decision making. The public are demanding more transparency and have the ability to really have the information to make their own informed decisions of where they get the best care or where they're not getting the best care as well. So I think without having, a minimum standard or benchmarking with these figures alone, it's going to be really without any context and not really guarantee really best practice care. So I think, you need that benchmarking against the professions that are actually providing the service delivery as well.
Thank you.
I might just able to add about financial transparency as well. I'm sorry, I want to keep you to time as well, but I was just thinking about that in answer following up from what Scott said. Do I have just a moment to...
Yeah, please proceed.
Yeah, thank you. Very respectful of your time. Thank you. The financial... I was just thinking about how ridiculous from, again, the pub test. I'm in a regional town. If I was trying to tell somebody that 50% of the local physios who worked in aged care were going to lose their jobs, I wonder how financially transparent or otherwise the providers making those decisions are, and how involved the public, who's got a right to know about their care for parents is, and whatever sort of financial reporting that would show those minutes that should be changing if you don't have 50% of your physios there. By whatever metric is being tracked, because the other thing Professor Hartland said, that is $700 million is spent every year on allied health, which is a figure I think a bit out of date from 2020's Stuart Brown deep dive. 4% of spend, he said. I've heard a lot of nurses, for example, and unions talking about whether they have confidence in direct care minute tracking, which is a mandatory requirement, and we have no mandatory requirement. So I'd be very curious, the public and the pub test again, if you're paying for, through taxpayer dollars, your parents and everybody to have allied health, and you'd want to be very confident that the allied health that is being claimed is what is being provided. And I will not make an allegation specifically about that, but I believe there could well be some further room in financial transparency for a regulator or someone else to be involved in that may show some things that I have heard, and I can't say any more about it than that I don't believe would pass the pub test, about services being not delivered that are being claimed for. And that's about as much as I'm able to say on that at this time.
Okay. Look, just my last follow-up on this topic. If we got the transparency provisions right in terms of reporting on allied care, allied health, noting, the importance of having an adequate definition, do you think that would encourage providers to increase the level of allied health provided?
I think if you split it up into the different disciplines, you might actually get better provision of care and specific disciplines that actually provide those services as well. So that full scope of physio or of allied health practice as well. I think that's probably the main thing, is to get the right person at the right place at the right time that delivers the best quality and the best access for that individual care.
Okay. Senator Pratt just had a couple of questions.
Thank you. Following up from Senator Smith's question, and thank you for your acknowledgement of my constituent Amina and her mother. She certainly does attest to the important role that physiotherapy had in enabling her mother to walk and extend her life, and very much extend the quality of her life as well. In the context,
she lives on through her daughter too, Senator Pratt. I just always see that smile of what she looked like after she had physio. But yeah, it's a lasting memory. Yeah. Thank you. Sorry.
No, thank you for sharing that. Could I ask, could reporting that required transparency on whether someone had had their allied health needs assessed and then addressed, and be a good measure of transparency. I'm sometimes a little bit suspicious of the idea that we can just put it all down to care minutes when we don't know how many people might have needed care or never had their needs assessed to start with. How does assessment of someone's allied health needs currently take place? And could transparency provide that leverage back into a facility by including it in the reporting? So, you know, if you've got a goal that 100% are going to be assessed, and that once assessed, and a facility is going to seek to refer 100% of people off to the relevant professional, how could we really leverage off transparency as a way of trying to close the gap in, you know, the impending change that you have concerns about?
Scott, do you want to say?
Yeah. Look, currently, Allied Health will assess each resident and provide an individual care plan and an action from that. But the current provisions under AN-ACC.
But and can you clarify for that? A physio is not necessarily always doing that. Might identify a podiatry need, but who does each individual profession do their own assessment? Is it done by a GP who then does the referral? How does that work? And where do we get the transparency over that referral process? Or are you going in as physios and addressing everyone for their physio needs, and the podiatrist is coming in separately?
I think how I'd respond to that is that it's a team. It's a team approach. It's a team assessment. So you'll have input from the GP, from the you know, if they come from a hospital system, then they'll have that referral from there. That some of their care plans from that. They might also they'll also have the registered nurse or the nurse that does their care needs as well, and then the carers as well. So this is where that whole team approach is very, very important, because the whole team does that team-based assessment and then formalize a plan moving forward. So your transparency is that you're getting such different aspects of care needs and care requirements all assessed by different people. But under the new AN-ACC, there's no real provision for comprehensive allied health assessment at all. It will just be by the facility, and that's it. No multidisciplinary care planning at all.
I'd have to disagree a little bit with what we've got right now, although I appreciate the sort of that side from what I've seen in our company and from the way we do assessments. We only do an assessment if we're referred to do an assessment. So, for example, that's basically who pays for it. So if we're not referred, we don't see somebody. And in terms of how we assess them, we've created our own assessment, but there is no standardised form I'm aware of right now. And we've asked Department of Health, how, you know, what's your form? What's your assessment? No, okay, we don't have one. And I don't think it should be on physios to say someone needs podiatrist following. You know, clearly that's directed by the nurse and answerable, I suppose, to the doctor and the family and the legislators. But we should be working in a multidisciplinary team. It's just, I just don't see it happening a lot of the time, unfortunately. I'd rarely talk to a podiatrist or somebody because I don't know when they're coming, and if they come, they've got a different aim than what I've got about a resident. Yeah.
Okay, well, perhaps you could reflect on what Senator Smith asked and really look at how transparency could be used to leverage that. Can I ask, when it comes to, I guess, cost shifting, seeing a physio is not something Australians can afford even when they need it. When people have their appointments with you within an aged care setting, when is the aged care system paying, and when are they paying privately or via some other mechanism?
Yeah,
and
sorry.
How can we maximise the value that comes into the aged care settings, because there might be other financial resources that can be brought in, but the current arrangements you know, if the aged care system says, oh, well, we don't want to emphasise allied health, or the system's not going, we might be throwing the baby out with the bathwater because, you know, there are opportunities to bring services in. How does that work currently, and what opportunities are there?
I was just going to say there are people who can afford physio and do provide physio. It's a well utilised profession, but in terms of
It is. I love my physio.
Oh, good. Yes,
my mother was one as well.
I'm glad they don't hurt you and you have a bad experience with them. We do get that from time to time. So it does, I'm sure.
It's only when my mother practices her physio on me that I am prone to screeching.
That's it. Don't do
I think
physio
that's a
on your
parent-child
family.
relationship.
Yeah, you don't do family physio. That's right.
Yeah.
But in terms of, I mean, we sort of reference this in our submission about. I know it's it probably seems a little bit trite, but it is. Even if someone can or can't afford it, they should be asked of what they would like of allied health, I suppose, is what I was saying. And I would take something. It wasn't Senator Wells, not Senator, sorry, the Minister Wells, who before Professor Hartland spoke in Sydney, that I was referring to. Basically, Professor Hartland said, come to us with solutions, not just calls for more money. And that's why I've shifted my position of what I'm calling for in our company is because I don't believe it's ethically responsible in society to call for more money for something that could be potentially abused or be seen to be the way the ACFI system was. I do think that some things you should not have to pay a physio for. I believe it's a human right. I said that a year ago. I believe it puts more load on staff and hospitals and everything we've referred to if you don't do them. Equally, maybe a client doesn't see some things as very important or willing to spend their money on, but society would argue if you've had a fall or a surgery or something else, you probably should have a review from somebody in a standardised way that everybody could see that was fair and not something that would advantage us or the facility. That's all I could probably say on that.
Yeah, so someone could, you know, decline spending their own money on a physio while they're in residential aged care because they'd prefer to keep that money in their children's inheritance.
I had this exact situation happen. Yeah, it's like you've seen.
But they should be asked, and the institution should say, look, do you want to access this particular allied health service? It might be of benefit to you, and that would generally, yeah, okay. So there are opportunities, in other words, to address some of these issues through transparency measures by reporting on whether every person has had their allied health needs assessed and how that was triaged and how it was followed up.
Well, if it's not written down, it doesn't happen. So, I mean, just that consultation process itself should be transparent of how that's been asked and who is asking, because at the moment it's very based on an external workforce that I would wonder how would be staffed, actually, to be honest, if we're having that many physios leaving aged care. Physios, OTs and nurses make up a lot of external assessors and I'd be wondering how they'd do it. But regardless of that, you should have very clear, just as you would with legal and financial consent, to make sure that it is not a financial abuse situation or, you know, the local physio or whatever it is. Yeah.
Do physios currently use the My Health record? And is there some ways of getting reporting going on these issues that aren't necessarily controlled by the institution that someone's residing in?
Yeah, look, a very good question, Senator, that we've been asking the Digital Health Agency for some time now.
Yeah.
At the moment, Allied Health have got very, very limited access to My Health record because we haven't got the infrastructure or the capability to interoperable with our systems. It's in the pipeline to be assessed to see how we're going about it, but we've been constantly asking the Digital Health Agency to assist in developing that, because it would be a system of improving the efficiency and effectiveness of communication between all properties and all practitioners.
Thank you, and thank you, Chair.
I'd like to thank both of you for appearing today, for taking the time to share your expertise with the committee. We appreciate it.
Thank you very much, Chair. Thank you, Senator.
Thank you.
I just note, if you did take questions on notice, they're due back tomorrow, I'm afraid.
No problems. Thank you.
Thank you.
Thank you for your time.
All right, I believe we should have in the room representatives from the Department of Health and Aged Care and the Aged Care Quality and Safety Commission. If we do, if those witnesses could come to the table, please. I'd like to thank you all for appearing before the committee today. The Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on a matter of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. In the interest of time, we're asking our witnesses to table their opening statements. Can I confirm that is okay with both agencies?
Michael Lai, Deputy Secretary, Ageing and Aged Care Group, Health and Aged Care, Department of Health and Aged Care. That's fine. Do you want to, shall I hand it over or have we?
Yeah, if everyone's happy, we'll move to questions then. Thank you. Senator Ruston is going to kick us off.
Thank you very much, Chair. So I'm just interested in advice that you may or may not have provided. I was interested to know whether any advice has been provided by the department about the decoupling of the 24/7 or the time that a nurse needs to be on site as opposed to the nurse care minutes, as was the recommendation of the Royal Commission.
Senator Mark Richardson, Assistant Secretary, Residential Care Funding and Reform Branch. Are you referring to the change timeframes in terms of the introduction of 24/7?
Yes, so originally it was 16/7 and 200 minutes and 40 minutes RN, and then the second tranche of changes was 24/7, 250 minutes with 44 minutes of RN care. And I was just wondering whether any advice had come from the department in relation to the separation, because they appear to now be in two different bills.
So it was an election commitment, Senator, in terms of, I guess, the introduction of 24/7 and the timeframes around the 1st of July next year. The decoupling, we have 24/7 in the primary legislation as that's a fixed time period. In terms of care minutes, as you've identified, that will change over time. So we'll have 200 minutes to start off with, increasing to 215. As such, it's more appropriate for that to be in subordinate legislation so that the minister can adjust those times moving forward.
But so you did or you didn't provide advice to the minister about the uncoupling?
When you say uncoupling...
well, clearly they were running together as a recommendation of the Royal Commission, and now we've had a change where the care minutes have been uncoupled from the time requirement
for 24/7.
For 24/7.
No, we did not provide advice on that. As I mentioned, that was an election commitment around the introduction of 24/7 and the timeframes associated with that.
So did you provide any advice to the government on the decision to implement 24/7 earlier than was recommended by the Royal Commission?
We're working with government to introduce that election commitment as part of the October budget process, Senator. So yes, we're going through those processes, as I'm sure you'd understand.
But you didn't provide any advice prior to the decision being made?
No, not as part of the election campaign, no.
So subsequent to that, have you or the department done any modelling on the ability to actually meet that commitment by the 1st of July 2023?
Are you talking about workforce requirements?
Yes.
Yes, there's been some modelling done. So to introduce 24/7, there's roughly an additional 850 to 900 registered nurses required.
Are you able to provide that modelling?
I'm sure we can, yes, take that on notice and provide some information around how those figures were determined.
And can you confirm whether that's 860 individual nurses or it's an FTE equivalent?
I'd have to take that on notice, Senator.
And if you could provide the modelling, that'd be great too. Have you done any modelling, and I believe you actually have provided evidence to estimates committees to this effect before, but unfortunately I wasn't there, as to what the department believes the likely workforce requirements are going to be for the delivery of commitments in the two pieces of legislation, the one that went through last sitting week and this particular piece of legislation. What will be the increase in the workforce to meet the commitments for registered nurse workforce for both those bills?
Senator, we have provided numbers in the past, but I think we'd like to take on notice. It's obviously dynamic, and then we've got we know that with the Fair Work Commission case that's likely to influence the numbers that we will have in front of us as well. So I think we could go away and have a look and try and give you an answer to that. That you're after the cumulative impact of all the different changes.
Yep, please. Because I'm sort of, and also in terms of that, I'm interested to know when you've done the modelling, what was of the increase, what is the base on which it has been built from? Was the data pre-COVID? Is it more recently collected data? I mean, are you working on numbers from now? What were percentages? So if you could just give us a base from which you actually built your data would be great. In relation to the three schedules that are in this bill, we've heard testimony from many people and received testimony from many people expressing, quite significant concerns about the lack of transparency around what is likely to be contained in the subordinate legislation for all three of the schedules. So I was just wondering when you will be in a position to be able to provide advice about what is contained in those schedules and who you've been consulting with in the development of those of that subordinate legislation.
Should we go schedule by schedule?
Senator, the Minister wrote to a number of organisations, including the National Aged Care Advisory Council, Council of Elders, and consulted on election commitments. So each of the three schedules relates to election commitments. This committee process as well is being used as part of the consultation process, and there have been 34 submissions to this committee around particularly Schedule 1 and how the exemption framework should operate. There's also been submissions around Schedule 3 and the nature of the information that the Secretary should be required to publish. In terms of broadly on Schedule 3, in the explanatory memorandum, there's some detail around the types of information that we're proposing to put in the subordinate legislation. The capping home care, I don't know if anyone wants to step in and talk more broadly about consultation on that, but consultation effectively is ongoing.
So, and the first part of my question was around when we're likely to see any details of this subordinate legislation.
So proposal for Schedule 1 is that it will be ahead of 1st of April next year when the schedule's proposed to start. So the consultation will be ongoing up until
So you won't know what the exemptions are in relation to something that's coming into effect on the 1st of July 2023 until April 2023.
I think you were referring to capping for April.
Capping.
You said Schedule 1.
Yeah, Schedule 1. So it will be ahead of the 1st of April when the exemption framework will commence.
Okay. So when are we likely to see any other subordinate legislation in relation, so for instance to the transparency requirements under Schedule 3, what will be required in terms of the information, the additional information that's going to be required to be provided?
So, Senator, I can take you through the information that's public around what's proposed to be included in Schedule 3.
So all of the information that is required in Schedule 3 is already publicly available?
Broadly, the department has put in the explanatory memorandum and discussed with the people we've been consulting with the types of information that we propose to make public.
Yep. No, that's okay. You don't, if you just want to take that
I'm
in
happy
the interest
to.
of time. So in relation to additional information that's being required under this transparency measure, has there been any assessment done on the additional cost that is likely to be required and the regulatory burden that may be required on facilities to provide this information, or is there none?
So the bill requires publication of information. The other side of that is reporting, which is dealt with elsewhere. So there are no new reporting requirements under this bill. They're just new publication requirements. If new reporting requirements come in, we'll need legislative amendments for that, and we'll have to do regulatory impact statements at that time.
Okay, so there should be no additional costs.
It's publication requirement for the department.
Okay. Just going into a little bit more detail around the requirement for 24/7 nurses in aged care homes by the 1st of July next year. Have you done any modelling about what you think the likely number of exemptions that are going to be sought is going to be, and do you have any clarity around the likely places those exemptions are likely to come from?
Senator, look, as I mentioned before, we're working with government as part of the October budget process in terms of exemptions and how that might work. We have consulted, as was mentioned, I guess, with a wide variety of stakeholders. What I can say is that I think the primary feedback on exemptions and 24/7 has first of all been that smaller facilities in rural, regional and remote parts of Australia will find it most difficult to deliver 24/7. And the other feedback we've had is that we should be looking at alternative models of care, such as on-call arrangements, video conferencing and those sorts of facilities.
Okay, so is that something that's proposed as a temporary measure or a permanent measure?
We're working with government as part of the October budget process in terms of what the exemptions might look like.
And have you done much consultation with with ACCHOs around the provision of in aged care homes that are run by our Indigenous controlled or Aboriginal controlled organisations?
So once again, I guess that's all part of the October budget process.
And I was actually asking you about consultations, not...
Yeah.
Have you been consulting with the ACCHOs around how this particular measure is going to impact on them?
So that's not, so to be quite frank, that's not in my area, Senator, but as I have consulted.
Sorry. No, so we, hi Senator, Liza Strapp, First Assistant Secretary, Market and Workforce Division. Yes, there has been consultations on the 24/7 measure and with our the new peak body, the National Aboriginal and Torres Strait Islander Aged Care Council. And I believe we've also talked to NACCHO about the 24/7 nursing and the exemptions. So there has been some initial consultation and we'll continue to consult with them around the exemptions and what that means for Aboriginal controlled organisations.
NACCHO made a submission to this inquiry.
Yes, yeah. I'm just interested to know what you've actually done in relation to specifically consulting with Indigenous Australians about this. So not what they've done, what you've done was more my question.
Yes, so we've been talking to the peak body and to NACCHO about these specific measures and the exemptions.
Okay. So in terms of the level of detail that is required to understand this, so for instance, a small nursing home in a small country area has a nurse, one nurse, so able maybe two to do 24/7. What provisions are in place or assumed, for that when that nurse goes on holidays? Would that nursing home be required to get a locum in during the period that nurse was on holidays, and and if so, at what cost and whose expense?
Senator, so look, once again, in terms of the costs of this funding and so forth, we're working with government as part of the October budget process. What I can say is that the Parliamentary Budget Office, during the election campaign, cost of the 24/7 commitment at roughly $500 million over the forward estimates.
Yep. Okay. Can you have you got a breakdown of what that $457.8 million or whatever it was is?
In terms of how it was derived, Senator, yes, I could take that on notice and give you some information in that regard.
So I'm interested in the sense of is it all actually funding that's going to be provided to facilities that currently don't have a 24/7 nurse on site, as opposed to the ones that currently do? I mean, is it going to rural and regional? So I'd be really interested to understand how you came up with the 457 million and how it was broken down.
So it was election commitments. So I think what Mr. Richards is trying to say is that we are now doing work with government on how to realise that, which includes, as you would suspect, how do we assist organisations to meet the target of 24/7. So that's a process that's ongoing. Yeah. But I think, I mean, I know that the senators don't disagree with the proposition the Royal Commission put, which is the need for, or the desirability to have 24/7 nursing for consumers in residential care, no matter where they live. And we do understand that we've got to do the work to help, particularly those services that you've mentioned in regional and remote, to try and achieve the desirable aim.
So do you have any idea how many actual facilities are going to require an exemption? Have you done any modelling around that?
It's part of the October budget process, Senator. We need to settle, I guess, with government whether or not there will be an exemption process, and if there is, what that would look like.
So there may not be one?
That's, I guess, modelling and so forth is taking part as part of the October budget process.
There just seems to be an awful lot of speculation around the fact that there will be an exemption mechanism and commentary to that effect. So are you undertaking analysis as to whether you even need one? Is that what you're saying, that there may be no need?
Senator, one of the propositions here is to say that if it's not disputed by anybody that it's desirable to have 24/7 nursing, then that's something that everybody at all times should be trying to achieve, but that you might not have an exemption mechanism, and you might recognise that some people are striving to that end, and that there is some recognition in the process of how we regulate or deal with those facilities who are in that process of trying to get to 24/7 and deal with them on their merits. So if they're making every effort to do that and they're facing legitimate barriers, that you recognise that. But so one concept, and I'm not saying that's where we're at, but that one concept is that you don't have exemptions, and that everybody's in that striving state constantly to get to 24/7. But you paid due attention to the fact that they might be facing a workforce challenge. There might be an issue with the worker being ill or on leave or some other thing happening.
So in the process of determining around exemption or other alternative processes to strive to achieve the outcome that obviously everybody's seeking, and I don't think anyone's in dispute that we'd like to see the best possible care for people in nursing homes, has there been any analysis in, like, at what point do the number of exemptions or whatever you want to call them actually exceed the processing value of actually waiting until 2024 when the Royal Commission recommended that we have 24/7 nurses in place, given that there are obviously many nursing homes right now that have 24/7 nurses in place. There are many that don't, and we know that the most critical need is most likely to be in shallow markets in rural and regional areas. I mean, has there been any analysis at what point this actually becomes a detrimental impact to the sector of pursuing this too quickly, as opposed to delivering the ultimate outcome?
So we might be able to help, Senator. I think we know what percentage of facilities currently have 24/7 nursing.
80%?
Yeah.
It's
What
over
data?
80
What's the
over
basis of that
80%.
data?
So that comes from our 2020 workforce census.
Is that pre or post COVID?
In the midst of COVID. So over 20%, over 80% have a nurse 24/7 on site.
So that was
and then
in
a
the
further
previous-
9% had a nurse on call.
So that was in the previous 14 days. They said they had a nurse on
Yes,
call in the middle of COVID.
That's right. Yes.
Okay, so would it not make more sense to be basing the decision on a normal operating time than in the middle of COVID, or haven't you done a survey since then?
Well, you would. We haven't. We're collecting workforce data. We don't have anything. That's our most reliable data. However, in consulting with many providers in the lead up to now, we believe that figure's pretty accurate to now. That 80%. But we are collecting further data to validate that, and I believe we collect that data through. We will be collecting data through the quarterly financial reports that are being introduced later this year.
Is it possible to provide a breakdown of the 80% that said that the 20% that said that they didn't have 24/7 around geographic location and possibly size and type of facility?
I'll have to take that on notice, whether we have broken it down to that level. I'm not sure that we have it broken down to that level.
Yeah, we understand what you're after.
Yeah.
We'll see what we can do.
Yeah, I mean, getting clarity around what these potential exemptions might look like, where they are, and the likelihood of the length of time of exemption being in place and would be useful. Just a couple of other questions. Is there a schedule of penalties that are likely to be applied to aged care homes that are in breach of meeting these requirements?
No.
Is there going to be?
There's no particular penalties attached to the requirements. So if a provider doesn't meet the obligation, and that may mean that there will be reporting on which the Commission will have a view of that and determine when it's appropriate to take action. And it would be the Commission's ordinary process of enforcement and compliance that would apply. There's no particular penalty attached to the obligation.
So there's a discretion for the Commission to determine if somebody is unable to meet their requirements as to whether any action is taken about them not meeting those requirements.
Yeah, so not discretionary for the Commission to determine whether or not they're meeting it, but in the usual process, yes, it would be for the Commission, and perhaps the Commissioner could elaborate on that, but it would be for the Commissioner to determine when action should be taken.
Sitting there very quietly. So I'd just be really keen to understand what your understanding and expectation is around the enforcement of the requirement of 24/7. I mean, is this something that you have any discretionary power about how you act? Clearly, from what Ms Metz said, you do. Do you want to add anything to that in your position?
Thank you, Senator. Janet Anderson, Aged Care Quality and Safety Commissioner. As Ms Metz has indicated, a provider will either have 24/7 cover or they won't, but the consequences of not having it are a matter for the regulator, the Commission I lead, to judge in the context of broader risks. We're not just interested in the setting, we're also interested in the outcome. And if the absence is temporary and there are alternative arrangements in place which ensure timely access to required clinical input to decision making and addressing of care needs, then it may be that there's no consequence beyond us talking with the provider and saying, right, please confirm your plans to replace or recruit to that position, what the timetable is, and come back to us the minute you've done it. And that may be the extent of it. Alternatively, if there's an absence of effort to ensure that there is a full roster of the 24/7 RN cover, and the provider seems relatively uninterested in addressing that requirement, we are more likely to take a more considered view, probably require them either to act very quickly in a particular way, or, depending on the other circumstances, issue a non-compliance notice, which then places certain obligations on them to make good, as it were, the oversight or the absence in a particular time. And we will certainly monitor their achievement of compliance with this requirement.
So you in the
Sorry,
start...
Senator Ruston, we have a few other senators with questions, so if we could...
Yep, sure. I just finished this, then I've got one other question. In the first part of your response, you said temporary. So would you restrict your ability to, for the non-compliance to only be a temporary non-compliance, or would there be circumstances where a permanent non-compliance, assuming that the facility or the home had demonstrated active effort and strong effort to mitigate against it, but was unsuccessful, is there a circumstance where that could be applied on a non-temporary basis as far as the Commission's concerned?
I think that's another way of asking a question about exemptions.
Yeah, permanent exemption. But
Well-
so this is your... They don't have an exemption in terms of the exemptions that may well be built into this exemption mechanism, but I mean, have you got the power, and would you exercise a power that said that somebody could be permanently exempt from meeting this requirement if you believed, like for instance, the acuity of care or the acuity of the residents required a much lower level of care, therefore a 24/7 nurse wasn't required on site? Could you determine that that was a reason for not being required to comply?
Senator, I know what you're reaching for, but I'm struggling
give me the
to...
answer.
No, I'm struggling to deal with the detail of the hypothetical because we could have so many individual circumstances. One of the strengths of the Commission I lead is that we deal with what's in front of us. We have a very dynamic appraisal of risk, and any one of those factors you identified there that cluster around this case study could change in a week or a month. So my Commission needs to understand that risk as it is moving over time and engage with the provider, institute a monitoring regime which keeps an eye on it. At a point in time, we might say, we're watching, we understand you're working hard, keep doing that. But if there's any difference or adjustment in one of the risk profile parameters, such as they very higher risk residents enter the home who have higher clinical requirements, if they continue to be unable to attract registered nurses 24/7 and their alternative arrangements are less than satisfactory, we will be having a conversation with them about what they're going to do about that.
Yeah, I'm just trying to get an understanding of the scope of opportunity for somebody to be exempt. And just finally, in terms of additional costs, has the department done any work in terms of determining the scope of the additional cost of the provision of the measures that are in this bill? What are they, and who picks up the cost?
The cost for
For all of it. I mean, you've talked about the 457 million. In terms of additional costs, the costs of compliance, the costs of... is there any additional costs that are going to be borne by the actual homes themselves, or is the government picking up the tab for the lot?
Senator, the total cost of Schedule 1 is outlined in the explanatory memorandum, which is 450.7 million.
Yeah, no, I'm asking you, are there any other additional costs that will that these measures contained in this bill that are not being met by the appropriation that's being proposed by the government in Schedule 1?
I don't believe so, Senator.
Okay. Thank you, Chair.
Senator, I'll just, I took on notice about the 869 extra registered nurses that were to be needed by 1 July next year. That's headcount, just confirming that. That's bodies, not FTE.
Okay, so you're in dispute with the advice that's been received from others. The other thing is you also said that you didn't actually have the numbers in relation to the 24/7 and the 200.
I think we said we definitely on public record that Mr. Richardson talked about the 24/7 nursing. We don't have on us the 215 and the 200.
So the 14,000 that you gave to the estimates back in February is you no longer believe is right.
Senator, I didn't say that. I said that it's dynamic. No. I think we need to re-look at all of those, the interaction of all of those figures. And to give you for example, we know from the Skills Commission that if the Fair Work Commission raises wages in the care sector by, I think it's 10%, it will make a very large difference to the current gap in workforce needed. And so there's a lot of variables at play. And so I think while we did give that figure back at that time, I think we'd like to be able to go back and have a look at the interaction of all these measures and come up with something more contemporary.
Okay, I think the Chair actually is going to tell you that you need to get your questions on notice back by tomorrow afternoon, but I'll leave her to tell you that. Thank you very much, Chair. Thank you. I apologise I have to leave, but I have a plane to catch.
My safe. Thank you. I've got a few questions and then I'm going to pass to Senator Rice and then Senator Pocock. I know you spoke to Senator Ruston a little bit about the consultation plans, but in terms of delegated legislation, can you outline for us your consultation plan with stakeholders? I'm particularly interested in what opportunities stakeholders will have to contribute to the process. That's for the department.
Schedule 1? Sure. So in terms of Schedule 1 and 24/7, we've consulted, I guess very broadly, Senator, with a number of unions and peak bodies and also the sector itself in terms of different providers to date. So I can go through a list if you'd like, Senator, but that's what we've done to date.
I'm happy for you to not go through the list in the interest of time. I guess I'm interested in how many opportunities stakeholders might have to contribute to the process. Is it a one-off consultation or is it more of a conversation? Are there more opportunities for stakeholders to engage on the delegated legislation piece?
So yes, there'll be more opportunities, Senator. We're engaging all the time. So there's opportunity for I guess all the peaks and so forth to come forward and I guess have a conversation with us, but we have already engaged with a number of them.
Okay. One for the Commission now. How much of a problem are unacceptably high administration fees in home care? Wondering if you can tell us what proportion of complaints made to your Commission relate to home care fees?
Yes, Senator, I certainly can. We receive a relatively high number and proportion of total complaints which relate to fees and charges. And I have some numbers here that I can quote. In terms of the financial year 21-22, we received complaints with 605 issues relating to fees and charges, and that represented 9.4% of the total number of issues that we received across the course of that financial year. 9% as a share of total is relatively high in relation to all home care complaint issues. And what we find is these gravitate towards communication and consultation between the provider and the consumer. They sometimes relate to the level of the fees, the management charges, which are levied on the package itself, and the disclosure provisions generally and the consent provisions in relation to the adjustment of arrangements also seem to come into question and trouble some consumers, where they bring to us concerns that they don't feel they know enough and that they're not getting good answers from the providers in relation to some of these matters.
Can you share with us some of the worst examples of sky-high fees in in-home care that you've seen?
Senator, I don't have any specific information available to me. The department undertook a program assurance review, which might yield some information.
That's right. So we did undertake an assurance review of the home care packages program, looking specifically at indirect and care management charges. So fully care managed charges, for example, on a level 1, range between 0 and 60%. For the total, for level 4, it ranged from 0 to 35% of the total home care package subsidy. So quite significant variation between providers.
And what explains that variation?
Again, that varies. It depends on.
Is that the challenge?
Yeah, it depends on what they include. And that was part of the exercise, is to seek further advice from those providers as to what they're including and what they're not. So, for example, in some cases travel is included or travel isn't included, or sometimes travel is a flat fee, sometimes travel is more expensive if that's a nurse compared to a personal care worker. So really what we found is there's just significant variability right across the aged care providers for not only the amounts but what they charge for.
Mm. I just want to go to the transparency of information provision, because I've had quite a bit of interest in that so far this afternoon. Could the department just clarify what types of information will be collected and published as part of the measures included in Schedule 3 of the bill? I know you said previously that information is publicly available, but if you could share it with us, please.
Sure, Senator. So the bill goes to providing the Secretary with the ability to publish information about aged care providers and services. And what we expect will be, and this will be included in the information principles, and that will include details of key personnel, attestations by the governing body that the provider complies with its obligations under the aged care framework, financial information such as the residential aged care provider's expenditure on care, nursing, food, maintenance, cleaning, administration and profits, service utilisation, initiatives the provider is taking to support diversity, and complaints about and improvements being made by the service. But I will note we are intending to consult, particularly with consumers, about the information that will be presented to them and how it is presented, so that it's published in a way that is accessible and understandable for people using the service and their families.
Right, and do you have some early ideas of how that information might be shared with older Australians and their families?
Yes, sure. So we're looking at how we present it in a way that's understandable and comparable. So, for example, we might want to include a cost per bed on a registered nurse. So per head cost of a facility, how much they're spending on a registered nurse, and then being able to benchmark that against like facilities, so that you're not comparing a big facility with a small facility and unfairly disadvantaging, say, a small facility where there's they might have a different staffing profile or a different staffing profile need. So allowing the consumer to see, to compare a like facility with a like facility and say, well, I can see how much they're spending on registered nurses. I can see how much they're spending on food as well per person, or how much they're spending on allied health, and we can break that down by the type of allied health professional as well.
Thank you. Can I ask, this bill seeks to increase these transparency measures. What is that expected to do in terms of choice and service delivery quality?
Well, I would expect, along with measures like the star ratings and quality indicators, that it's putting the power in the consumer to find out about the operation of a facility or a provider, to know how much they're spending on things that matter to the consumer, like staffing, like food. It might be lifestyle care. It allows the consumer to easily access information without going through reams of very complex. I find looking at an aged care financial report, it's hard for me to understand. It's giving them the access to see what's the position of that provider, what's their financial position, how many. What's their kind of profit and loss margin, what might they have spent on capital to improve a facility so they can see if a facility's put money into upgrade to provide better facilities for consumers.
I think too, Senator, it provides our very best facilities to showcase the good service they're providing. And that provides an incentive for other providers who will have to be disclosing, their details to be transparent, to lift their effort and to try and match the very best in the system. So not only does it give control to consumers or power to consumers in the market, it actually will hopefully create an incentive for providers to lift their game.
Thank you. I'm going to pass the call to Senator Rice now.
Thanks, Chair. And look, a lot of the questions that I had have been covered, so I should be fairly quick. Senator Smith asked about your consultation on the exemption, and I'm not quite sure what you committed to table, but could you table for us, I know it's questions I noticed by tomorrow, all of the details of the consultation that you've done so far and what you plan to do on the exemptions?
Yes, Senator, and I'm conscious that we only gave it for the first schedule. We gave you an outline for the first schedule, but we'll happily table that, the forward going and what we've done for each one.
Thank you. Did the department provide any advice to government about whether these measures regarding the exemption should be in delegated legislation or in primary legislation?
So, Senator, the design of, are you speaking about a particular schedule or the bill as a whole?
I'm thinking about, in particular, the delegated legislation that's going to outline the exemptions. And we've had a lot of concern from people expressed today about the fact that we've got no transparency over that at the moment, and because it's in delegated legislation.
Yeah, so the design of the legislation with the obligation in the principal legislation and the exemption framework outlined in subordinate legislation is quite deliberate. As you know from a number of the submissions that have been made to the inquiry, there is a diversity of views on how an exemption framework should operate, in what circumstances it should operate, how long exemptions should be, and whether the exemption framework should change over time. And it's appropriate for that level of operational detail to be provided in subordinate legislation so that if circumstances change and workforce needs change over time, that the amendments can be made to subordinate legislation. And I'll just note as well that it will be a disallowable instrument, so it will be tabled and subject to the disallowance process as well.
Okay, but am I right that this measure in February run about putting in place 24/7 nursing care, that can't happen until we've got the details of the exemptions that will be in place through the delegated legislation?
So the obligation itself will commence on the 1st of July, so under the bill. The exemption framework, it's not a requirement that it be legislated, but we're anticipating that it will be legislated before the 1st of April next year.
Okay, so the obligations, well...
Then the obligation could operate in isolation of anything being in subordinate legislation. There's an additional aspect to the subordinate legislation that it allows the obligation to be extended to certain other providers which are not covered in the bill, which covers residential aged care providers. So there's potential to expand to multi-purpose services as well under the subordinate legislation.
Okay. My other question in terms of things that aren't in this legislation is where we're at with the timelines for the new Aged Care Act. And when you mentioned in your submission that there's work underway on the new Aged Care Act. So are you able to update us on anything in relation to timeframes there?
So, Senator, proposal is that a bill for the new Act will be introduced next year. Exactly when that happens will be a matter for government.
Okay. With regards to the new 24/7 nurses and the extended minutes of care, we've already heard, and your department's estimate now is that 800 or something extra nurses will be required. What work is the department doing to ensure that there will be these sufficient extra nurses available so that aged care facilities can meet the standard?
Yes, Senator, we've got a range of, the government's got a range of measures that are intended to help increase the number of nurses in both residential, mainly in residential aged care. The first part of that is we've provided a submission to the Fair Work Commission in support of a pay rise for registered nurses and other aged care workers. As well as that, we have increased university places for nurses. We've got a range of programs that support new nurses coming into the sector and also incentivise nurses currently into the sector to remain. One of those is the nurses bonus payment, which the first payments should be going out in from November this year, or October this year. And that's for anyone who remains in the aged care working for a facility for 6 months to 12 months, they get a bonus payment. As well as that, we've got the aged care nurses transition to practice program, which provides wraparound support for new nurses entering the sector. We have nursing scholarships. We are also providing support to providers through the Workforce Advisory Service to assist them with how they might do workforce planning, how they might recruit nurses, how they might assist their HR practices to attract more staff. This is very much being used by providers in regional, rural and remote areas who might not have those level of skills to attract or to provide, I guess, employee value propositions to nurses. So we have a range of measures in place that we believe is helping to boost the number of workers, a number of nurses in residential aged care to meet that requirement on 1 July, and the care minutes into the future.
Okay. And with regards to overall minutes of care, so what's the approach going to be on legislating that?
So the care minutes itself, the 200 and the 215, that will be subordinate legislation, Senator, as part of the quality standards.
And I don't know if you heard the testimony from the Physiotherapy Association just prior to you presenting today. Were you listening into them?
The last couple of minutes, Senator.
Okay. I mean, they were deeply concerned about the fact that there is going to be a massive, there was already a reduction in physio and other allied health professionals. In fact, their estimates is probably going to be about halving of the number of physios in aged care facilities, and that there's going to be a generational loss of physios And it's not going to be possible for facilities just to be bringing in physios on a case-by-case basis. And so physios and other allied health services are really going to crash at aged care facilities. Is there any consideration to including allied health professionals in that minutes of care?
Senator, just as a preamble, I'm not sure that we would agree with their analysis, but I'm happy for Mr. Richardson to explain.
Sure. So the minutes of care, Senator, and the funding associated with it are consistent with the Royal Commission recommendation. So the funding is for registered nurses, enrolled nurses and personal care workers, with the Royal Commission identifying that I guess an increase in care minutes for those professions were required. In terms of allied health, I think what I'd say, Senator, is that the funding will exist within ANAC as it does under ACFI for the provision of allied health services, and that facilities are also required to provide those services under legislation. Allied health services are part of the quality standards, so the Commission would be looking for the provision of those services as part of their regulatory action. But look, there's also improvements, I think, under the ANAC model compared to ACFI in terms of allied health. Namely, unlike ACFI, if a resident improves, a facility does not need to seek a reassessment of the individual's ANAC classification. So that does create an incentive, Senator, for a facility to provide allied health services. And there is no linkage between funding and the type of allied health services that might be provided, such as pain management. So facilities are now free to provide the type of allied health services that's required by their residents in accordance with care plans. But look, I'd also... Sorry, Senator.
Oh, no, I was just going to ask you, though, to respond to the evidence from the Australian Physiotherapy Association, which represents physios, right across the country, that their estimates from their members is that there is going to be a 50%, we're looking at having a 50% reduction in physiotherapy and basically contracts having been cancelled at aged care facilities. And there'll be 50% less physiotherapy being provided in aged care facilities after the ANAC begins.
Yeah, Senator, I don't think we'd agree with their analysis, but we do understand that with a new system, and with the requirements under care minutes for those particular types of service to be increased, that people are looking at that and they are worried about the changes. Now, I think, as Mr. Richardson's saying, if we saw reductions in the use of allied health, anything like the scale that the Physiotherapists Association is saying, that would in our minds would put facilities in trouble in terms of their adherence to the quality standards. So, that would be an issue for Ms. Anderson to look at. So I think, do understand, people are trying to grapple with a whole lot of changes, and we understand why they're kind of looking at that and potentially worrying that they'll be worse off, but we don't think that will be the case. We'll be watching very, very closely to see what the behaviour of facilities is, though.
Ms. Anderson, are you watching very closely to see what the behaviour of the facilities is already? Because there is certainly ample evidence of physio contracts being cancelled.
Senator, we watch closely, full stop. We have a monitoring brief across the entire sector and for particular services, and in particular those services which have a higher risk profile. Where we find shortcomings in care and poorer outcomes for consumers, we track that back and reach an understanding of how that is the case. Sometimes it is a shortage of allied health input. Sometimes it has to do with other profiling issues in relation to staffing, and sometimes numbers and capacity in terms of, or capability rather, in terms of their training requirements. So I think that the short answer, Senator, is back where I started. We are watching closely, and we will certainly be looking at a system level and also in relation to individual providers and services.
Well, could I take you to an example that I have personal experience of from an aged care facility that my mother has previously been in respite care in, and so I still happen to be on their email lists, and they've sent out an email to everybody on their list to say that physios would no longer be providing gentle massage for pain relief, and if any resident wanted to have gentle massage for pain relief, that their other staff would be providing that. That sort of thing be of concern to you?
It would. I really can't answer on the basis of the information you've provided. I can understand why you would certainly have questions about that, but I would need to understand a lot more about the basis of that decision and the impact of that decision. If other staff were equally competent in delivering that form of care, then it may be that there's no particular issue there to warrant concern. On the other hand, if that's another way of saying it will no longer be available, that leads me down a different track in terms of the questions that we would ask of that provider.
My concern is, yeah.
Sorry, we've just got to get to Senator Pocock and then perhaps we're almost at time. Are you okay for us to move on?
Look, I've got one last question, having raised that, and I'm just deeply concerned given the evidence that we've had. But that was, in fact, back to the department, just a question about the transparency measures in Schedule 3, whether providers will be required to report on each facility separately, or will they be aggregated?
Yes, Senator, they are required to report on each facility separately. They have to report. So we get this data through the aged care financial report, and that's at a facility level.
Okay, thank you. Thanks, Chair.
Thank you. Senator Pocock, I'll pass to you now, and then Senator Pratt, just noting we are at time. So the department, thank you for staying over, but if we could be efficient. Thank you, Senator Pocock.
Thanks, Chair. I'll try and be quick. For the department, the regulator released a report in June showing that despite the Royal Commission, more than 500 sexual assaults in aged care happened in a 3-month period. How confident are you with this new legislation that it'll actually create a safer environment for aged care residents?
I think that directly, I think that the link is more indirect and really relates to the staffing and kind of eyes on in terms of aged care services and the sort of work that can be done in terms of incident prevention and incident management. So I would see that that's where the main change in this legislation. Of course, previous legislation of serious incident reporting, which is what you're referring to, has also shone a light on that, and programs that both the department and the Commission have introduced on training programs, sexual assault awareness, those sorts of things we also hope will impact and reduce those numbers.
Okay, thank you. And what mechanisms are being put in place to ensure that care minutes are actually used for care? Any?
Senator, so we've got some detailed information out there, some fact sheets and so forth that go to the details of that. But we will be undertaking quality checks of the data that's provided to us in the quarterly financial reports. We'll be comparing information across reports, ensuring consistency, looking for any variation or outliers, Senator.
Okay, thanks very much. And just one last one for the Commissioner. This new legislation obviously creates new and very welcome requirements on providers, registered nurse, 24/7, more care minutes. What's the process for people that visit their loved ones and realise actually there's no registered nurse here? What's the process for them registering a complaint?
They contact us by telephone, an 1800 number, or they can send us an email and log their complaint, and we will take that directly back to the provider and seek a response from the provider to the issues and concerns which have been raised with us. We may or may not be satisfied. We go back to the complainant and they may or may not be satisfied. And by that process, typically we reach a resolution and I might also say we may stand up an adjacent process. So we would seek to resolve that particular complaint and in the course of doing that we may also engage with the provider separately and possibly contemplate other regulatory action if we find that they're non-compliant and uninterested in fixing the problem.
And do you have sufficient resourcing to do that effectively and potentially have to scale that up?
Senator, that's certainly a subject of discussion in the government budget development process.
Have you had assurances that that will be the case?
I am confident that sufficient account will be taken of what we need.
But no assurances yet.
Senator, one of the things the government's done is bring forward a capability review of the Commission, and that was an election commitment, I think, and so that process is really looking at whether the Commission has the right resources to do the job that we're asking them to do.
So that'll ensure that the Commissioner has enough resources to be able to deliver that?
That's correct. That's the intention of the review.
Okay. Thanks very much. Thanks, Chair.
Thank you, Chair. I'll jump straight in. I have had many queries from constituents who've been unhappy with the complaints handling process, and I guess they feel like the legislative framework is means that they're not getting the full picture of what's happened to their loved ones, etc., in terms of after there's been an incident or a complaint. So in the context of the transparency measures in this bill and future legislation, can I ask what consultation is happening around those issues, what consideration for reform, and specifically whether you'll consider issues with freedom of information and the withholding of personal information which family members would like access to, that's either being held because it's commercial in confidence or because, or for other reasons that really in the interests of the momentum towards transparency need to be looked at. Thank you.
So, Senator, as you know, there's a Royal Commission recommendation specifically around freedom of information. The transparency provision in this bill goes quite far in the opposite direction of the current arrangements around protection of information of providers, and it provides a very broad scope for the information principles to specify information that the Secretary has to publish to the world at large around providers. FOI is a...
And what about individual complaints and freedom of information about individuals? Will that be picked up by...
Yeah.
By this, I'm looking at, for example, the AAT review of decision clauses at the moment. So I'm interested to see that intersection.
So the FOI changes aren't being made at this time. It's something that's under broader consideration as part of the new Aged Care Act. So as part of that reform process, we're going to be revisiting all of the secrecy and confidentiality provisions that are in the current legislation. So the FOI legislation effectively prohibits disclosure of anything that's covered by those secrecy provisions. And we have to do some work with the Attorney General's Department around how the new Act will intersect with the FOI process.
So there might be a need to amend the FOI Act in order to implement what the Aged Care Royal Commission has said?
We think if we get the confidentiality and secrecy provisions right in the new Aged Care Act, then the FOI issue, there will be consequential amendments, yes, but we don't think the FOI issue will be the same as it is now.
Okay, and transparency around complaints. I very much appreciate the overall transparency momentum here. I want to know how that's going to translate down to, individuals who are inquiring about the care that their loved ones receive or raise an issue.
So the complaints framework is also under consideration as part of the new Aged Care Act.
Thank you, and that's me done, Chair.
Thank you very much, very efficient. That now concludes today's hearing. I'd like to thank all witnesses who appeared and to Hansard and Broadcasting for their assistance. We are asking for answers to question or notice to be returned to us by the end of tomorrow if possible. We do have quite tight deadlines with this inquiry, so we would appreciate your cooperation with that. The committee now stands adjourned.
Oh, sorry, Senator Smith, sorry.
Thanks, Chair. Thanks, everyone.
Oh, apologies, someone was interrupting me.
Sorry, I'm just reflecting on an answer we gave to Senator Rice about physiotherapy, and just to be kind of transparent, I think we do have an issue potentially with the old ACFI funding model where there was potentially probably some encouragement to use physiotherapy where it might not be appropriate to the individual's needs. And so it is possible that there will be some adjustment under the new model to better align, make sure that the person, based on their assessed need, gets the right allied health assistance. And so I just wanted to say that because I think that, you know, there could be some behavioural adjustment with physio,
So in
particularly
that
as a result
context,
of that.
dental massage doesn't need to necessarily be delivered by a physio, does it? It wouldn't be all that common for physios to do gentle massage, and that would fit with what you're talking about.
That's an example, that's right, Senator.
But it does need to be done by somebody who has got some qualifications in it, not an untrained staff person.
Indeed.
And, yes, there may be some adjustment, but the 50%, that's a lot of adjustment.
Well,
Thank you. I've technically adjourned, but I re-adjourned.
Thank you.
Thank you.